Good evening. In compliance with Chapter 551 Open Meetings of the Texas Government Code, I call to order a public hearing and regular voting meeting of the Board of Trustees of the Austin Independent School District for Monday, September 28th, 2020 at 5:04 p.m. We are continuing our transition back to in-person meetings tonight, and so a quorum of the board, along with a limited number of our staff members, are physically present at AISD headquarters to conduct this meeting. While the remainder of our staff participants will join us by video, we are following necessary health protocols to ensure the safety of those of us who are here in person. But please keep in mind we are continuing to comply with local health orders and CDC guidelines, and so we are not yet able to open our meetings to in-person attendance by our full staff and community. We will be continuing to use the virtual platform until it is safe to do so. This meeting is streaming live on AISD.TV, Facebook Live, and Apple TV. It is also being broadcast on cable channel 22 through Spectrum, Grande, Google Fiber TV, and on channel 99 through AT&T UVerse. Closed captioning in English is available on these platforms for the hearing impaired. And to our audience tuning in remotely, welcome and thank you for joining us. We will move to the approval of the agenda. Secretary Ellens, do you have a motion to approve the agenda?
So moved.
Is there a second?
Second.
Having a motion by Secretary Ellens and a second by Trustee Letitia Anderson to approve the agenda, all those in favor, please raise your right hand. So the motion passes by all those on the dais. Secretary Ellens, will you please lead us in the Pledge of Allegiance and the pledge to the Texas flag? Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Juro lealtad a la bandera de los Estados Unidos de América y a la república que representa una nación bajo Dios, indivisible, con libertad y justicia para todos. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Honro a la bandera de Texas. Te juro lealtad, Texas, un estado bajo Dios, único y visible. Thank you. Tonight, we will briefly recess for executive session and then return for a special presentation on our reopening plan, which will start at 5:30 p.m. Dr. Mark Escott, the Interim Medical Director for Austin Public Health, will be joining the superintendent to discuss reopening and the health and safety plans in the district. So we will now recess the open meeting at 5:07 p.m. and move to executive session pursuant to Texas Government Code sections 551.074 and 551.071. For purposes of this video meeting, the board will now leave this open meeting, which will remain live online and convene privately in a separate video meeting. When we're finished with our executive session, we will reconvene here. And again, we thank you for your patience. Now reconvene the open meeting at 5:35 p.m. And the first item on our agenda tonight is an open for learning update under the superintendent's report. And we want to welcome Dr. Mark Escott, Interim Medical Director and for the Health Authority of Austin. Dr. Escott, thank you for joining us tonight.
Pleasure. Happy to be here.
Dr. Elizalde.
Board President, trustees, the coronavirus pandemic has brought unprecedented levels of personal and professional upheaval upon all of our employees. Clearly, these are not normal times. And yet, as a society, we must continue to move forward. The pandemic presents a clear threat to employee autonomy because of its looming physical health risks, the uncontrollability of its effects on economics, constraints on physical movement, and of course, but not least, new protocols that are required for all work environments. So with that, I would like to remind all of us that we are always about health and safety first and foremost. We care about all of our employees. I care about all of our employees. Teachers are the heart of our work, and we also depend on support staff like counselors and custodians and our food service and our bus drivers and our maintenance employees, plumbers, electricians, groundskeepers, principals, assistant principals. The list goes on. All of our employees surely have concerns during this pandemic. That said, Austin ISD starts with students in its decision-making process. I cannot praise our teachers enough for the virtual instruction improvements that have occurred. I have heard from many of our parents, our constituents, about the quality and the length of time that our teachers are spending virtually working with our students. We will never be able to thank them enough for the work that they are doing. The reality is, TEA does not provide for any option that allows 100% virtual instruction. That is not available to us. In addition, parents will have a choice for the entire school year of a virtual environment should they decide to do so. Not every district is offering that. We will continue to offer virtual instruction to any parent who so desires. This pandemic is very difficult for everyone. I do want to address the rhetoric that when we are talking about our survey of responses from our parents, that because we have that available to parents, as we are required to do, does not mean that we care less for our employees or less for our teachers. Just as I know that because teachers are having to make these decisions, as are all of our employees, that does not mean that they do not care about our students. So I ask us to focus on looking for pathways to success in working together. And because of that, I'd like to announce to the trustees that this evening, I have put together a group of 40 teachers to create a teacher group that will provide us feedback and ongoing advice and recommendations. I did get an opportunity to talk with one teacher at length last week, and I really heard the idea of being participatory in this process. So while I do not know what amount of involvement teachers had as this plan was designed prior to my arrival, I do think that it is important for me to practice people support what they help to create. And therefore, I'm happy also to say 23 of the 40 teachers have already agreed to serve and work with us, work with me to find alternate ways of meeting teachers' needs. As we said, this is a year like no other. We also have some challenges with regard to just the enrollment that we have at this time. And I bring this up because funding is the reason, again, that we all know there are certain requirements that the Texas Education Agency has and why they have them. So I would like to see if Larry Throm can speak to a couple of slides that I put together, and I don't know if we have those available to show. Is Larry Throm available?
Yes,
Larry, would you mind, please, sir, going over slides 3 and 4?
yes. Slides 3 talks about the membership challenges that we're having. And we portray those by looking at our membership at the same day last year, and the most recent one, day 14 out there. So then we look at day 14 from last year, and we can see in the pre-K, pre-K4, and the kindergartners that in September 25th, we had 8,727 students signed up. Last year, we had 11,445 of them signed up. So we're down 2,718 students there, and that's pretty significant for us. And next, we look at the early students, the pre-K through 3 through 6. Last year, we had 41,800. This year, we have 37. It's down 4,836. Middle school is down 298. High school's up 289. Other specialty schools, negative 274. And whereas last year we had 80,261 students, this year we have 75,143. That's the combined, those that are getting regular instruction and those that are virtual, I guess, there. So that 5,000 students, and we don't get paid on enrollment, we get paid on average daily attendance. And so we adjust, and our average daily attendance is 95%. So we kind of adjust for that when we do this financial calculation here. Each one of our students earns the district approximately $10,040. Some students more, some less, depending if they're special needs or they're free and reduced lunch, or they're in the vocational program, special ed, bilingual. They can make costs that they would generate more money. So we take the 5,000 students times the 10,040, and it's $51,394,000. Take 95% of that number, and it's 48,000. And so that is the number that that we would lose that income if this continues as it is here.
You meant 48 million, right, Larry?
Pardon?
You meant 48 million, not
Yes.
48,000.
There you go. Thank you. 48 million. Now those 5,119 students, you got to ask how many teachers would that involve to teach that many? Well, if we divide it by 22, assuming they're all in elementary, and they're not all going to be in elementary, they'll be scattered out. But if you just do that 22, then you would need 232 teachers at the elementary, less doing that. And the significance then is that when you multiply those 232 teachers at about $70,000 a teacher, that includes the hospitalization and workers' comp and Social Security matching that we have to put out there. That would be 232 times $70,000 is about $30 million. So we would save $30 million in salary by eliminating that many positions at 232 positions, but we would still be $20 million short of eliminating all of the loss, the 51 million. So we cannot just save our way by letting teachers go. You could argue that you could let other types of personnel go, and we would certainly have to do that if this, we would certainly have to consider that, I should say, but we're going to have to cut something. And if we don't cut payroll, which we're about 85% payroll, then we're going to have to go to non-payroll costs. So We don't want to alarm anybody. These are facts, and we'll wait to see in another 2 weeks or a week. We're taking attendance daily, see if we can't improve on these numbers. On slide 4, slide 4 gives us the fund balance dollars at the end of the year. The actuals are noted there from 2014 all the way up to 2019. The 2020 audit is still underway. It will be completed the end of October. The board, and it's going to the board in November for approval. We're estimating end of year fund balance of $314 million. And if we do that for 2020 and use that as a base, well, that becomes that if it's the ending number for 2020, then the beginning number for 2021 is at $314 million. And the board adopted a budget that we would refer to it as a deficit budget, in that the expenditures exceeded the revenues, the estimated revenues, state and local revenues of $1,429 million, but we adopted the expenditure budget of $1,485 million. That's 56 million more in expenditures than revenues. So then if you take that 314, so where's this money going to come from? Well, it's going to come from fund balance, because we can't print money. So 314 times that 56 or 57 million dollars of excess expenditures leaves us at the end of the current year, the 2021 year, right now, it would be 258 million in fund balance. And of course, again, that's predicated on the 314, if we are indeed at 314, and we will know that and share that information with the board just as soon as it becomes available.
Thank you, Mr. Throm.
Thank you.
So the next slide, and I think now you may have a hard copy in front of you as well. I'm on slide 5, and I'll be turning this over to Dr. Escott in just a minute, because I know several of you may have some specific questions. And Dr. Escott has been kind enough, I would like the trustees to know he's actually on vacation, and got permission from his significant other to be able to be here. So I'm very grateful to him and his family for allowing him to do this. I just want to go over this slide because this comes straight out of Austin Public Health's guidelines. We are always going to be as cautious as is possible. And I would like to reiterate, we delayed the start of school, and we went the longest amount of time virtually that's allowed by the Texas Education Agency for the purposes of being the most cautious school district possible. And so we delayed that so that our data could possibly improve, which it did. And so I just want to mention we are in stage 3 according to this guideline, the risk-based guidelines. And Dr. Escott is constantly reminding us it is not just one indicator that we have to look at. It's multiple indicators that guide our experts in how they design these guidelines. But I'd like to stop here for a minute so that trustees, President Rodriguez, would be able to ask a few questions with regard to reopening schools while Dr. Escott is available.
Thank you, Dr. Elizalde. Trustee Letitia Anderson.
Thank you, Dr. Escott. I am a trustee who works with the elderly population. And for the longest, well, since the pandemic started, I have been on a rant about testing. And so what are your thoughts specifically on testing as it relates to reopening, and God forbid somebody gets COVID-19 at a campus? What are your thoughts as it relates to testing?
Thanks for that question. And again, I'm happy to be here. Right now, our testing is, we have more tests available than we have people wanting to get tested. which is a good problem to have. When I've met with the superintendents and we meet weekly, I've made the recommendation that testing, proactive testing, really be focused on those students where we know the risk is higher. In particular, the clusters that we've seen at schools that have reopened have been related to extracurricular activities. In particular, we've seen clusters in band, in football, in cheerleading, and we've also seen clusters associated with social activities. So my advice to parents is if your child is involved in these activities, if they've gone to an event, a party, a gathering of some kind where masking and social distancing were not practiced, then proactive testing, meaning asymptomatic testing, is a good idea in those circumstances. Certainly, we are working closely with the school districts, including AISD, when a case is identified, to then identify those close contacts who need to be quarantined and then tested. Now, a lot of people ask me, well, should I get tested right away or should my child be tested right away? And the answer is no, because it takes a while for the virus, once you're exposed, to convert and become able to be detected. So generally, we advise people to wait, unless they develop symptoms, about 7 or 8 days before that first test to see if they converted or not. And we're hopeful in the future that as the data improves, that we may be able to shorten the length of the quarantine period. But right now, we have to stick with the 14 days after exposure before those students can be released back to school.
Thank you.
Dr. Escott, as we continue to ask questions, I was wondering if you might be able to share with us what we as a governing body should know about getting kids back into the classrooms.
Absolutely. Let me just say that AISD, Dr. Elizalde, Dr. Cruz before her, we've been in communication for months and months, talking about what are we going to do, how are we going to open, and this really has been a collaborative effort with Austin Public Health and school districts around Travis County. Back in May, when we first started having these discussions, we talked about the need to have flexibility in the system because there are going to be people, teachers, staff, students, and their families that have different levels of risk and different levels of risk tolerance. And building a system that allows that flexibility is going to meet the needs of most individuals. And so I think being engaged in that flexibility process as much as possible is important for a governing entity. I think it's also important that we are constantly reevaluating the plans we have in place and the new data that comes in to play. I will say that as Dr. Fauci said earlier today, we don't have a lot of data about spread within schools specifically, because for the most part, schools have been closed. As we gain more information, we may need to pivot either in a more cautious way or in a more liberal way based upon that new information. So I think it's important that the board and that families across the school districts and the faculty and staff understand that things may change, the recommendations may change, and that's going to be based upon the science and the facts that we have at the time.
Thank you, Dr. Escott. Trustee Cindy Anderson.
Thank you for being here, Dr. Escott, and please also thank your significant other for allowing us to interrupt your, I'm sure, well-deserved vacation. So one of the things I've been hearing a lot of questions about is, so could you provide your professional medical opinion about the greatest sort of transmission of risk? Is it between children and adults or adults to adults? Because I've heard some different perspectives on that.
Yeah, so the pattern of transmission that we've seen related to schools have been within age groups. It's been student to student, it's been faculty to faculty, more likely faculty exposed outside of the school setting. Uh, we saw the same with teachers. I mean, sorry, we saw the same with nurses. We saw the same with doctors. We saw the same with, you name a profession, that's the pattern that we've seen. And I know there's a lot of anxiety about transmission in the classroom space. We just don't have the evidence to support that right now. Our perception right now is that the masking and the distancing, the hand hygiene, the hand sanitizer, the hand washing, and the constant reinforcement for the students is really doing a great job at limiting the spread within the school system. That means our concern is what happens outside. And I think this is why it's important to reiterate in the classroom space on a regular basis the importance of that commitment to safety. It's not just in the classroom, it's in everything we do so that we can not only protect ourselves, but we can protect our friends and our family and our teachers as well.
Thank you for that.
You, Trustee Wagner?
I'll also echo the thanks to you for joining us this evening. My question is around contact tracing, and I was wondering if you could share a little bit more about your professional recommendations for how many degrees of extension of how much duration of time, proximity is recommended as far as notifications and recommended testing for anybody that may be around someone who tests positive.
So our recommendation is based upon the CDC guidance, which is within 6 feet for longer than 15 minutes as a close contact. Part of the process of doing the case investigation is getting further details. For instance, if we find a situation where somebody didn't have a mask on, or they were coughing or sneezing while they were in a space, that's going to raise the index of suspicion. So we may want to widen the net a little bit on who we pull out of the classroom and keep under quarantine. Beyond that, it's doing surveillance on those individuals and ensuring that if they develop symptoms, for certain they get tested, but also to ensure that they understand that they can get tested even though they're asymptomatic. Again, we recommend they don't do that immediately, that they wait at least a few days, the optimum time 7 to 8 days after exposure, to really give us a good idea of if they're likely to convert during that 14-day period or not.
And I guess my question too kind of extends to in a situation like a school where you may have multiple kids, crossing through a single area like a music room or, those types of things. How much do we, at what point do we ask people to stay home and quarantine after something like that? At what point do we ask people to test after something like that? And I think that is a little distinction I'm not quite completely clear on as well. So
certainly, we don't have any evidence that passing in a hallway is leading to transmission of disease. Generally speaking, when we've seen transmission of disease in high school and college age students, it's when the masks are off and they're face-to-face interacting, having a meal, having a drink, or just socializing. That's when we're seeing the transmission. We're not seeing transmission, haphazard when people are passing or running past one another, or simply sitting in the same space. I will tell you that I have been at work in person for 6 months. Austin Public Health has been at work in person for 6 months. Have we had cases in my office? Yes. We've had, one case at a time spread out over months. No transmission at all in that workspace. And there are quite a number of people working there. But if people are following the guidelines, if they're masking, if they're social distancing, paying close attention to their personal hygiene, and most importantly, and I cannot stress this point enough, the self-screening before they leave the house every day is absolutely critical. We've got to be committed as a community to doing that screening on ourselves and on our children, and having a plan. What am I going to do with my child if they have a fever, if they have a cough, if they have another symptom? Because we don't want people to be pressured to bring that child to school anyway. So again, we've created multiple layers of protection. That adds to the fact that we have a decreasing positivity rate. And I think it's going to become more challenging for the virus to penetrate those multiple barriers if we are all committed to continuing those protections and being vigilant about them.
Thank you.
Thank you, Trustee Allens, and then Trustee Ashe.
Thank you, and good to see you again, Dr. Escott. I really appreciated when you met earlier in the summer with the whole group of Central Texas trustees, and just knowing that we have been sharing data and working together this length of time is, I hope it gives me some comfort. I hope it gives others some comfort as well. I did want to just ask a little bit, and within education, we go beyond, and we have a lot of extracurriculars, fine arts, athletics, and even in our elementary schools where we have our what we call specials, PE, art, music. Is there anything in that space where you would give us some guidance that might be a little different than just the general messaging?
So let me say that regarding the younger children and things like fine arts, we have evidence now that transmission from younger children to adults is low. Again, we have to pay close attention to the evidence to make sure that doesn't change. But I think, for that age group, it's important to ensure that we are reinforcing that hand hygiene, that teachers are wearing their masks, and that we are doing all that we can to mitigate that transmission. I will say in relation to higher risk environments, we have concerns about choir. We have concerns about band, particularly instruments that you blow into, then projecting finer particles into the air and staying suspended. I know that some school districts have retrofitted some of the instruments with devices to help prevent that. But ultimately, I think we have to pay close attention to what's going on. And if we identify a gap in our protection, we've got to solidify that. I don't want people to feel like we're experimenting. That's not what we're doing. We're going with the best evidence that we have, the best practices that we have. And Travis County has been more cautious than any other jurisdiction that I know in doing the 25% and then 50% and then going up from there. And I'm proud of that. I think that says a lot about our community. For those who are concerned about putting teachers at risk, I'll say that I'm married to an educator, and she went to school today, and she has been at school in person for, ever since they opened back up again. My children are both doing in-person education. And why did I make that decision? I made it because we don't have significant risk in our household. I made that decision because I was confident in the school district's plan to not only protect the students, but to protect the teachers. And I have the same confidence in the plan for AISD.
Thank you very much.
Thank you, Trustee Ashe.
Thank you, Dr. Escott. I really appreciate, again, I think I'm just going to echo what everybody else said and say thank you. I did want to ask, and I don't want to put words in your mouth, but I think it's probably the most direct question that I feel like most people are asking, which is based on our numbers in Travis County at current, and based on the things you were just said with the lower positivity rate, it does sound to me as if you're saying you are in support of the reopening of schools. But again, I don't want to put words in your mouth and was just wondering if you could speak to that.
Thank you for asking the question, and I'll answer directly. Yes, I support the reopening plan. Yes, I support it by sending my wife to work, or being comfortable with her doing that, and sending my kids in person into the classroom. Um, this is a challenge for all of us, and people ask, why can we do this now and we didn't do it in the spring? The answer is the spring was much different. We didn't have tests. We didn't have PPE. We didn't have a system to manage the data to make informed decisions. We were flying blind. Now we're not. Now we have systems in place. We have masks in place. We have physical barriers in some circumstances in some classrooms. We have a lot more knowledge than we had then. And I believe that if the community is engaged together in making sure the schools stay safe by screening themselves before they leave the house and by being actively engaged in the masking and social distancing inside the classroom and outside the classroom, not only will this be successful now, we can continue to keep the schools open throughout the semester.
Thank you. I appreciate it.
Thank you, Trustee Ashe. I think we have some questions from Trustee Singh.
Hi, Dr. Escott. It's great to see you again. Thank you. So I had some questions. One is right now I'm looking at the school guidance document that Austin Public Health put together. So I wanted to make sure that that was still up to date, kind of a valid document that I could reference.
It is. We are looking at some revisions on that, but
Okay, great.
when those are done, we'll send them out.
Okay, great. And so, so according to that, so stage 3, we can have up to 50% on campus learning. So we are being more conservative right now than Austin Public Health's document. I think one thing that would, which I appreciate, one thing that I think would be really helpful, and this is really more for Dr. Elizalde, is if we could come up somehow with our own version of this beautiful rainbow chart, maybe in consultation with that teacher group you put together and Dr. Escott and others, because here in Austin, we tend to be a little bit more, conservative with our reentry approach for good reason, I believe. So I just wanted to put that idea out there. I do have some specific questions though. So right now, from what I've heard, the positivity rate has been is under 5%. Is that correct?
That's correct.
Okay. And I know that Education Austin has been asking for no return to school until we have a positivity rate under 5% for 14 consecutive days. How many consecutive days have we been at a 5% positive, under 5% rate?
I'd have to look and see if we can calculate the daily positivity rate. We've been hovering around that 5% for 3 weeks or so.
Okay. And so positivity rate is the percentages of people who test positive out of however many are tested. And so is that the key metric that we're using here for return to school, or are we also looking at infection rates? Are we also looking at positivity or infection rates for different age groups or different demographic groups as well? How does that plan in, and how do you advise we use that in our planning?
So again, when we consider the staging of risk, we are looking at a whole host of factors. We're looking at the new admissions to the hospital on that 7-day moving average, which today is down to 13. We look at the positivity rate. We look at the positivity rate within age groups. We look at the positivity rate across races and ethnicities. We look at ICU and hospital and ventilator capacity. There are a number of things that go into that decision regarding staging, and we've been in stage 3 for quite a number of weeks now, and that's something that we not only created here, but a system which has been echoed by the National Academies of Sciences in their publication earlier this summer about what communities should do when assessing the risk for the community. And I do like the idea of creating a similar guide for AISD, and certainly willing to collaborate with the school district on that document.
That's great. And thank you. And so I guess one concern I'm hearing is like we have schools that are in zip codes where the positivity rate is 3 times that of Travis County. So like, should we still, I mean, I keep going back to this like equity versus equality things. Like, do we do the same for everyone, or do we have different considerations for different campuses? Do you have any advice on that?
Again, I think it's really up to individuals, their families to see the data and to make a decision for their child regarding whether or not they want them to be in person or virtual. You can slice the data in a bunch of different ways and come up with different results. And you'll see that this week's update on our positivity by zip code has shifted significantly. My zip code where I live was twice the community positivity rate, and now it's less than the community positivity rate. So it's going to vary week to week.
Sure.
But ultimately, with the multiple layers of protection we have in place, I think with the general positivity rate across our community, it is safe to open and do that progressive reopening that we've described.
And I promise I just have like 1 or 2 more questions. Can you talk a little bit about the risk for teacher, like if a teacher is healthy, but they have a child or a family member who is immunocompromised, what risks are there really for their family member if that teacher is sent back to the classroom?
So again, that's difficult to quantify. Depends a bit on what that individual teacher is doing to protect themselves. Again, we've got those layers of protection in place: the screening, the masking, the distancing, and we don't have any evidence of transmission within a classroom type of setting. If that is a teacher who is involved in extracurricular activities where masking and social distancing are not possible or practical, then that may represent a higher risk than if they're in a classroom type of setting.
Okay.
And ultimately, that individual is going to have to make a decision of how they want to proceed.
Okay, thank you. And then do you feel like N95 masks are going to become available to school staff anytime soon?
I'm not sure on that. I seem to remember that TEA had purchased a large amount of masks, and I thought some of those were N95, but I don't have clarity on if that is still the case and how those will be distributed. Certainly, there's N95s available now. If individuals want a higher rated mask to protect themselves, that's certainly something they could do.
Okay, and then my very last question is: we have this dashboard now where we list our COVID infections in our district. I think it would be helpful to have, like, I see the number. I think last time I checked, it was 8 positive cases in the district, but I don't have like a denominator, so that 8 by itself is hard for me to interpret if that seems like a lot or if that seems like a little. And so I guess for you and Dr. Elizalde, it would be really helpful on our district dashboard to put like out of how many students. Maybe that's there and I missed it, but when I looked, I didn't see that. So just some feedback, and I would hope that TEA would kind of take that and do that statewide so that we can really make apples to apples comparisons across districts.
Again, we're certainly happy to work with the district on any data that they need.
Dr. Elizalde, do you feel like that's something that we might be able to include in our dashboard?
I think we can include a every day, and we're reporting this by week. And so, for instance, if someone actually appears on campus and is physically on campus, but they are a contracted employee that day, and that might have been someone who was positive, it might be reported, but I don't, did I add that person to the denominator or the entire school? But certainly we could come close. We could do we know if we have 100 or if we have 50 people in the building. So
Sure.
I definitely think we can find something that would give you a comparison of to how many folks we have in a particular building. Absolutely.
Thank you so much. That's it.
Thank you, Trustee Singh. Trustees, any other questions? Trustee Letitia Anderson.
Last question, I promise. Can you just, and you touched a little on it with Trustee Singh, but can you just touch a little on any recommendations for those classrooms that are life skills and, TAs or teachers have to restrain students and whatnot? What are your recommendations as it relates to that?
Certainly, if there are situations where teachers have to be in closer proximity to students, then they may consider more significant personal protective equipment. So that could be mask plus face shield. That could be N95. Certainly the cloth mask is designed to be utilized in association with distance. If that's not possible, then a higher level of protection in those circumstances may be reasonable.
Thank you.
Trustees, any other questions?
So the last thing, Dr. Escott, is I just wanted you to be able to affirm that I get to meet with you once a week, and I get to ask lots of questions, and I ask for guidance, and other superintendents are able to also provide us data on how their reopening is going. And that because you had nothing else to do, you actually reviewed our plan prior to this evening.
I did. I always look forward to our 2:30 Monday meetings. And I'll tell you again, it's been refreshing to see the engagement from you and from the other superintendents. We're faced with a situation where, TEA has said, hey, school districts, you don't have to listen to public health, local public health, if you don't want to. And it has really been a pleasure to see the level of engagement and the commitment to really abiding by the local direction and local opinions on what we should be doing. And I'm thankful for that.
Thank you so very much, Dr. Escott. I appreciate it. All of us do.
Dr. Escott, on behalf of the board, thank you so much for being here today, especially on your vacation. But most importantly, to share with our community your focus and guidance around science and facts. And I think that's really important, especially in this time period. So we really appreciate your time.
Thank you so much. And again, it was a pleasure to be here. I appreciate all that the district is doing. And I just want to say that we have a lot of heroes in this community, but I can't think of any greater hero than our teachers, our educators. I know myself and all of my colleagues can name teachers who've made a difference in their lives. And, I know this is challenging for them, but we need you. We need you to do what you do best. And you're just an irreplaceable part of our community. And I want to thank all of our teachers out there for what you do every day.
Thank you again.
Thank you so much. I do have one more slide, trustees, and I think I have Dr. Hawley. Are you available, Dr. Hawley?
I am.
Thank you so much. Dr. Hawley has been, since I got here, I think I've pretty much hitched her to my side. So we can always talk. She and I love to have conversations about equity and how we're going to change the world. So with that, she always challenges us in our meetings to think differently, and I greatly appreciate that. And on this particular slide 6, she's going to talk to us about what we heard from our communities.
All right. Good afternoon, good evening, trustees and Dr. Elizalde. And as Dr. Elizalde said, we have had great conversations, not just the two of us, but our entire team. We've been talking and really looking at things through that equity lens, which means that we look to see what our families have to say. And as you can see on the slide, students can't lose a year. And I love what Dr. Elizalde said in the beginning is this is student informed, it's family informed. And so what you're looking at here is just a distillation of the data that we have from the survey that was sent out. And just keeping in mind when you look at this data, despite everything that's going on, you can see elementary, middle, and high school. You can see there's interest in returning to face and getting back on campus. And we know, and as our families know, that our students, particularly in elementary school, learn better when they have that face-to-face instruction. And so you can see basically, and I love the way this data has been boiled down, so you can see that we're responding to family needs, to what people are saying they need for their children. And then I want to just piggyback just a minute on what Dr. Escott said about families make the decision of whether or not they want to return. And so I really believe that the district has set up the best model that we can, setting up options for families, those families that know that some of their children have not received the kind of instruction and the kind of personalized learning, even though I do want to say that our Dr. Erin Bound Anderson has done a phenomenal job in leading the team with the online learning. We also know all the research shows us that our youngest learners are the ones that need that face-to-face. So here you have what our families are saying to us about how crucial it is for them to have choices. And we know families will make the choices that are best for their students. And what we're trying to do is make sure that we're creating a space where those children have a way to learn based on what we know is best for them at this point. So I will just stop there and take any questions that you might have.
Thank you, Dr. Hawley. And before we get to questions, on slide 6, I just want to summarize the data. We had over 72% of our parents responded. 84% of those came from the elementary, 65% middle, 58% high school. And then when we actually take the percentage of the on-campus from the percent responding, what we get is 19,203 student or parent responses between elementary, middle, and high that are requesting in-person instruction, which is 26% of enrollment.
Yeah.
Of the total enrollment. But of course, it's different from levels.
Yeah, Dr. Elizalde, thank you for doing that. In doing this and looking at this work, and I appreciate your making it plain. Sometimes we put up the slide and we expect that people can see what's there, and so I appreciate that you really pointed to what's important about our decision making and how these numbers and these percentages, as you look here, how they inform our decision making about the reopening process. And so appreciate that.
President Rodriguez, we can take questions.
Trustees, questions? Trustee Letitia Anderson and then trustee, I'm sorry, Trustee Cindy Anderson, Trustee Letitia Anderson, and then Trustee Antesh.
Thanks. I just have one question at the moment. When will the survey be offered again? I've heard some concerns from families because the details regarding what the delivery of education will look like has changed a couple of times, and some may want to change their mind. And so in order for us to have sort of the most current response, to be able to plan for what we need and how many kids to expect, will the survey be offered again, and at what point?
So there are two ways we could do that. We could certainly offer a survey again. That was not our first thinking. Our first thinking was simply to allow parents to request a change, because we have committed ourselves to 5 days of working with parents to meet their needs as long as there's space available, given, for instance, that we're at the 25%. So as long as we're within that, so for 2 weeks, even though it would be the first 2 weeks of 25%, we still don't know, and particularly at a particular campus, that campus may not be, it could be at 13% or 14%, that particular campus. So if the parent wants to put in a request to now come in person, we would work with them on a campus by campus way of meeting their needs. That was the original design, but I can certainly get back with the team and see what we think about doing. Our concern, of course, with surveys is everybody's kind of survey fatigued sometimes as well. But maybe we could even, maybe doing that survey at particular campuses rather than district-wide, but might also be more helpful based on the percentage of parents that have responded.
Yeah.
I appreciate that. And I think there are a number of different. Another opportunity in the event parents did want to change their decision as more information or different information has become available.
And that's a good question. A lot of our principals are really on tap to meet those needs. So as families are communicating with the principals, that's going to be another avenue for them to make changes as well.
Trustee Letitia Anderson.
So I have two questions. My first question is to Dr. Elizalde. Can you just talk a little bit about what those special area teachers, what it would look like for students going into, you know, PE, art, music, what that would look like? Is it going to be a whole bunch of kids going in there? Is it going to be a limited number? What would that look like as we begin to phase in the reopening?
So again, let me reiterate that it's 25% of the students that are coming back at each campus maximum. So that means we will have social distancing in every classroom. Now, each campus, because of the facility size and makeup of the building, in some campuses, it could be that a teacher is going into that room to provide that particular set of instruction. On another campus, it could mean that students are going into that teacher's classroom. However, it is still going to be social distanced. It's still going to be with masks. And what we did commit to is not requiring teachers to have to go to more than one campus during the day, because some of our teachers had to be at more than one school. And so we think that that's, I mean, we know that this is stressful across the board, but one of the things that we can assist with is working a different schedule so that our teachers do not have to be at more than one campus during any given day.
My next question, good evening, Dr. Holly. So I've seen tons of emails about equity and reopening. And so can you just talk a little bit about your thoughts or recommendations or your input on this reopening process, if you would, please?
You're on
mute.
So where to begin? I've been in the reopening meeting since March and April when we really started these conversations. But the key thing that I think everybody needs to remember, particularly as it comes to equity, is to honor the voices of the most marginalized folks. And so when our families tell us what they need, then we need to be responsive to that as much as possible. And of course, health and safety are paramount. And I think our AIS team AISD team has gone beyond um, in terms of the safety aspects, and Matias Segura's team as well. But when families tell us what they need and what they want, equity requires that we listen and try to provide choices for people. And that means quality choices. And that's what we've been working on as a team. It's really been important. The whole piece about listening and then seeing how do we do what it is people say they need us to do, and give them the flexibility to change their minds, as we talked about just a few minutes ago. So yes, there's been a lot of engagement and involvement with internal, external staff members, and with our families as well.
Thank you.
Thank you, Trustee Anderson. Trustee Teish, and then Trustee Singh, and then Trustee Wagner.
So, Dr. Elizalde, I have a couple of questions. First of all, would it be possible to publish on our COVID dashboard the number of cases per campus? Right now, it's just district-wide, to kind of give, I guess, our communities confidence that we are following protocols, that we are keeping numbers down?
So I guess I have a different copy because I thought we have it by campus listing as well. But if not, then absolutely, we can see about what level of data we can get out to our communities so they see it by school. Let me check on that because I
Okay.
do know I have it by campus, but maybe that's not what we're actually
I didn't
putting
think
on
I
the
saw it on the
dashboard.
dashboard, but it may have appeared and I just haven't kept up with it. And then secondly, one of the number one concerns that I've been hearing from teachers is about this requirement to teach face-to-face and then to teach virtually also. And I appreciate the email that you sent today. I believe that we got it from your office, that more support is going to be given to teachers to handle that situation. Could you describe what that's going to be what that will look like?
Sure. And let me also thank you for that, Trustee Teich. The general student-centeredness, just so that, because I do want to, like, when the question is like, well, why can't I just teach virtually versus why can't I just teach in person? So if we were to do that, then all the students that would be returning might have completely different teachers than they've had for the first 4 weeks. Conversely, the same is true. So, and it would happen over and over again every time students would be in or out, or if teachers would need to come in and out. So that's the first thinking. The second is, and we need to, because it's clear to me that we've fallen short of providing the support for teachers to know, for example, if we were in a classroom setting right now and I were the teacher, all of us could be on our computers right now and I could do my synchronous portion for everyone at one time. But then when I assign asynchronous work, because I'm not on Zoom all day long, we know that's not a good practice. So when I assign students to breakout sessions, or if I assign them asynchronous work, then that's the time I could then take my classroom that's in person and I could use them as a breakout group and I could do some interactions, still social distancing, but have more of an interaction of a Q&A, of pointing things out. So I think providing them, what does that look like and how is this not another lesson plan? Because what we don't want is I have to now create a whole other lesson for the same group of students. And I don't believe I've seen either a schedule or a modeling of what this would look like. So we intend, I'm going to work with our curriculum department for them to be able to go and provide both in person for anyone who would like that, as well as some videos of what that would look like. And then a way in which they could, like a webinar where they could ask us questions so that staff could support them.
Thank you.
Thank you. Trustee Singh?
Hi there. So this has been so informative. I really appreciate it. So Dr. Elizalde, I guess one question I have for you is how will we know if this reentry plan is successful?
I think the first thing is I think there's two groups we have to survey, and that's going to be our teachers, which I intend both to gather feedback from the campus level, our principals, our teachers, and that group of teachers across our district that I've just put together as a group to meet with me of 40 teachers, gathering that multiple feedback. And then I think the feedback from our students and our families. I think that will indicate whether we are assisting in meeting the needs that they are expecting us to meet or where we've fallen short. And in fact, it could be that we have some pockets of excellence where maybe other campuses might be able to borrow from those experiences where we see maybe some results of higher student engagement, higher attendance, maybe increased enrollment. So I think all of the metrics that we traditionally look at could be very helpful right now. I think enrollment, I think there's some indicators that as we open, we could have some pre-K students and kinder parents who have indicated they would be interested in enrolling, but currently with it all virtual, they're feeling like that may not be meeting their needs. So I think enrollment, attendance, engagement, participation, grades, and then I think how parents are feeling. And then, as I mentioned at the very beginning, I think being able to gather information from the campus level implementers of the teachers who are at the forefront and then our principals would be valuable.
Okay, great. I appreciate that. I'm guessing that also, as you were speaking, I was like, I'm guessing some health data would probably be thrown in there as well.
Well, we'd constantly be looking. That's why I'm sorry, I should have said, that's why we collect it regularly.
Yeah.
And so I'm going to check and see, as a matter of fact, I'm texting to see if we would be able to identify the data by campus level, as Trustee Teich indicated. We're going to check and see what the availability is for us to do that.
Thank you. I also want to thank Dr. Hawley for that presentation and just the way you described it. I could tell you were following the equity by design process that you've been teaching all of us in the district the last few months. I really appreciate that. I wanted to bring up a few concerns that I'm sure y'all have been hearing too, and just want to give you a chance to talk about that. So can you talk, there's a lot of concern about the quality of education if a teacher is teaching both online and face-to-face at the same time. So can you just tell us, shed a little bit of light on, what that's going to be like and how that's going to work? Sorry, my dog wants to know too.
Okay, so I think it's as I described just a few minutes ago, Trustee Singh, that the teacher, because currently when I've even sat in on some of our outstanding teachers, when they're conducting Zoom, let's keep in mind that the amount of time that you're doing that is real time, the synchronous part is a small portion of the whole day. We should not have students engaged online all day long. That's not considered a good practice. So in the schedules that we've provided for our staff, we've talked about what the recommendations are. In most of those instances, the teachers then have the amount of time that is synchronous or real time, where I'm providing maybe a direct instructional piece. And then they have asynchronous time, where students are then doing work on their own. Teachers then have either office hours or they may have breakout sessions. So the difference would be that your classroom would be one of the breakout sessions or one of the breakout rooms, the students that would physically be there, so that you don't have to do an additional lesson plan, that you don't have to do something separate, but rather you would just treat that group of students from the perspective of they're one of my breakout groups and I interact with them in the extension or reviewing of information. Does that make
That
sense?
helps. Yeah, and I'm going to ask you something, a follow up, and I apologize if you already addressed this, but for the little kids, the pre-K kids and through first grade, is it also going to be that way where there's going to be some at home and some face-to-face?
Based on our surveys, yes.
Okay.
I mean, again, keep in mind that if, I just want to keep mentioning, because it's not because we don't want to adjust to requests, but rather if students don't, if we split those groups, you begin to not have the same teacher. And Austin ISD has prided itself on social emotional learning, relationships, whole child. And so it doesn't seem that we would be keeping to that board priority when we, would create a whole bunch of inconsistencies with teacher and students. So, we're going to get some of those, as we all know, just because of mobility in our district, but we wouldn't want to exacerbate that by creating an additional change.
Okay. And I also wanted to ask Dr. Hawley, you had that table that had all the survey responses. Can you tell us if you saw any patterns by different demographic subgroups?
So one of the things that we've not been able to do as well as we'd like is to look at the demographics on a deeper level. We've been able to look at schools and looking at the school populations as well. And there were multiple ways for people to be able to respond to the survey. So let us put it this way, it is difficult to do a conventional survey in the way that we're accustomed, in the way that because I know you're a data geek, right? And we did not collect this data in the conventional ways. So we had families were able to call in and give their responses. They were able to go on Facebook. They could go everywhere basically and respond to us in different ways. And so we didn't see any patterns because I've been asked many times, tell me what our families that are identified as low income, like what were their responses? They were not a monolith. Our Black families were not a monolith. Our Latino families were not a monolith. Everybody has their own reservations, just as our affluent families are not a monolith. So I didn't see, at least from what we were able to gather, I didn't see any patterns across demographics.
Okay, that's interesting. That mirrors kind of what I've been seeing. I keep looking for a pattern and I haven't seen one. It seems like everyone just wants to have some choice. The other thing was, so I want to thank Mr. Throm for his presentation. It was a little bone chilling, I'm not gonna lie, to see kind of the financial context that we're in. I do want to just take a moment and just, as I often do at these meetings, is just to please ask folks to pay attention if you can and advocate if you can. We're just starting to work on our advocacy agenda, and it's going to be all about finances and making sure that our district keeps getting the funds that to serve our students. Same thing with charter school reform. There's a lot of work we can do there. So I want folks to know that to me, it looks like the district is doing what it can and making the best of a really bad situation. So, take that for what it's worth, but I think we've all got to advocate like we've never advocated before and make sure we get legislators in office that are education friendly. I can't endorse anyone here, but that's just really, at the legislature, they're the ones that decide how much funding we get, how much recapture we have to pay. And you saw Mr. Throm's presentation. We are, depleting our reserves because of this unprecedented crisis. And so I'm sure that if we could, we'd have to hire an army of teachers to give everybody who wanted virtual instruction, dedicated virtual instructors, and everybody who wanted face-to-face, dedicated face-to-face. And so I don't have the answers, but I just wanted to provide a little bit of context. It's not just our decision at the district level. There's things happening at the state level that are putting us, I think, in this situation largely. So I guess my last question to Dr. Elizalde is, I know the plan for the first 2 weeks is 25%, and then we bump up to 50. What would have to happen in order for us to not go to 50%, like stay at 25?
Well, since we report all of our COVID data weekly and Dr. Escott reviews that and I get to meet with him every Monday, I would simply continue to just discuss the data with him. And if he advised that we needed to not go to 50%, then that's what I would do.
All right, thank you all so much.
Thank you. Trustee Wagner and then Trustee Ashe and then Trustee Teich.
Well, and I want to say, Dr. Hawley, I appreciate the additional context around what we're seeing from different community groups and student groups. I wondered, and I think particularly being able to talk about disaggregated data and the challenges of being able to look at it that way, but I think it's also really telling to think about that there really aren't monolithic demographic groups that are participating in a particular way or a trending way. One thing I did want to ask you, though, is that now that Governor Abbott has changed the number of people that will be allowed to, gather in public places, go to restaurants, things like that, do you anticipate that we will see changes in terms of knowing that some of our parent groups are more likely to work in some of those service industries or may have to report to work where they may have not had to before? Do you think that that will change what we'll see from parents and families?
I really can't guess about that because many of our families who are essential workers have been working throughout, right? So they have not had a disruption, a number of our families. And again, that speaks to one of the trustees who asked if we would do another survey or, principals will be checking in. So I anticipate if things change that we will certainly continue to ask our families what they need and what they want, because we do know some of our families need children in school regardless of what's going on. They want their children to learn to read, and they are not teachers. And so they're really depending on us to make sure that their children get the skills and get what they need. And so again, we would need to be great listeners, as I think our principals are. And so that's my guess. I can't really guess what may happen as we gradually open up.
And has there been any discussion about, because I know we always run into a place of survey fatigue if we're constantly going out with survey after survey after survey to parents and caregivers, but have we discussed any scenarios where we may be able to employ our counselors or our parent support specialists to make sure that we're doing frequent check-ins with families to know where they are and what they're needing, especially our families that have been historically underserved or marginalized in our communities?
Yeah, that's great. And that's a great question because our parent support specialists have been doing a phenomenal job. Our counselors, our SEL folks. And so one of the things that this crisis is doing is really binding us and building some relationships in a different kind of way. So a lot of that listening is happening. A lot of the things that the equity office knows, we know from our parent support specialists. And it comes from a different kind of relationship that we're developing with our marginalized communities. And so everybody is getting into the community engagement realm, into that work. And so as a district, I think we're all becoming far more engaged, whether it's counselors, teachers, principals, because the families are relying on those relationships to make their decisions as well.
And I think I do want to make note too of all the work that's been done by Leno Vargas and her parent support specialist team. They historically don't work during the summer when students are out of school, but they stayed on this summer just to make sure that families did have access to critical information. They knew about things like, where there were food drop-off points, things like that, just to make sure that our families really did have that touch point. So I did want to make note of that.
Absolutely. And no more surveys. We've heard from lots of folks that, no more surveys. They really want that high touch. They want that personalized contact because We've got too many surveys, and AISD is not the only entity surveying as well, so.
Great, thank you for that, Dr. Hawley. And I think my other questions are really more directed at you, Dr. Elizalde. I did want to understand a little bit more about, and partly these are my questions and partly they are questions that I hear coming from community where there still is a lot of confusion or uncertainty or even lack of trust because there's been conflicting information that's been shared over time. So that's where a lot of these are coming from. But one of the questions I'm hearing is, about, we've talked about parent choice already. Now I'd like to talk a little bit more about teacher and staff choice. And how does the district determine why all teachers need to come back and report in person on October 5th? And secondly, how do we determine whether a teacher meets the medical criteria to be able to take a leave or continue to stay virtual? And then a follow-on question to that too is, of the teachers who have applied for medical leave or medical, I can't remember the term we're using. Accommodations. Thank you. What percentage of teachers have been granted those accommodations and staff as well, and what percentage have been denied accommodations?
So first, with regard to why would all the teachers need to report? So when our students begin reporting on October 5th, our students aren't going to come in bundles of classrooms. They're not going to come in Mrs. Teitch's room. Those are the only kids that are going to show up, or only teacher Ashley's. They're going to come 5 here, 4 there, 3 here. So the idea that we would just have teachers there for 25% would mean, again, as I described before, then we'd be doing an entirely new schedule because those students, again, are going to come from teachers in the entire, so, and I think I haven't been able to like adequately explain that it's not just a group individually. It's open to everyone because that's a requirement. However, when we max out the 25%, we said we would focus on certain grades first. But it's still going to be, as you may recall, part of the priority allowed employees' children, regardless of the grade level, to be part of the first group that could attend. So that means, again, you can see that we're going to have students from all grade levels in all different classes. So that's why we can't just say, and 25%, remember, we're talking about social distancing in classrooms. So we're only having 10, 11, 12 students in a classroom. So all of the teachers will have the small number of students in their room, and some are going to have more or less than others in person. The question with regard to the accommodations. So the accommodations do require 2 parts. One part is the medical eligibility. And so the medical eligibility, we do utilize the CDC guidelines, and the most prevalent that qualify are those cancer, chronic kidney disease, COPD, immunocompromised, type 2 diabetes, and pregnancy. Now, just because you have one of those doesn't automatically, it means you're eligible for us so that we're consistent. You meet the eligibility. However, the accommodation of saying that you want to work from home, the question still has to be asked, what is its impact on the organization? If it puts the campus in a situation where, for instance, if there's only one calculus AP teacher and this teacher has the eligibility, we still might not be able to approve that because there's only one calculus AP teacher, and therefore that would put we wouldn't be able to meet the needs of the students in that setting. Another example would be if there were 4 third grade teachers and 2 of them had already been approved for an accommodation to work from home, and we got another request and that person still meets the eligibility, but now it's going to again put undue stress on the system of serving students, then we might not approve that. However, in general, looking for the numbers, we have approved, and I don't know if Dr. Medina is available. I know we had approved, there were, I don't have that in front of me. I'm sure they're going to find him for me. There is Dr. Medina. Dr.
Yes.
Medina, good evening. Could you very briefly speak to the number of accommodation requests we have and the number that have been approved thus far, please?
Yes, we have had 925 as of this past week, 925 teacher remote work requests. And of those, we have approved 504. So the percentage is a little slightly over 50%. That's 54%.
Thank you, sir.
And I think that's a little different than the number we received.
The number you received included non-teachers and teachers, and this was just teachers.
Okay.
But
That
I'll
is
be happy
correct,
to make
Dr.
sure we have
Elizalde.
clarification. Yes, sir?
That is correct, Dr. Elizalde. We did receive non-teaching requests of 537, and we approved 264, and that was roughly 49%.
So we've denied how many? Just
So,
make sure I'm following the numbers correctly.
Right. So the number of denials, let's see, I have those here. I don't, Trustee Wagner, I don't have that exact number here. I thought that yes, the number of denials total have been 9.
So we still have some that are in the queue as we're waiting on documentation on several of these, correct?
Well, and
That
that's
is correct.
the reason I asked the question is because when you say this many have been approved, it sounds like we have denied
I
the
see.
remainder.
Yeah.
But what I'm hearing you say now, and based on the table that you emailed us earlier in the day, says that we have we haven't gone through the full approval process for everyone who has applied yet. But of everyone who we've reviewed, we've approved 50% of the people who have applied have already been approved, but only 9, I think 10 was the number we had in the table we received earlier today.
That were actually denied.
So over 500 have been approved, 10 have been denied over the ones that have been reviewed so far. Is that correct?
Yes, and Trustee Wagner, we do have some pending, as you say, we receive them daily, and we do have some pending. But again, yes, that data is correct. Are
Okay.
correct.
And the reason I wanted us to talk about that very clearly is because I think that there's a lot of fear on the part of staff who have not been reviewed yet of what that means for them. And I think being able to see those percentages is helpful. The one thing though, I think it was a little bit troubling in what you said, and I want to make sure I clarify to make sure I'm understanding correctly. If you use the example of the AP calculus teacher and saying that that was the only teacher on a campus that had that subject matter expertise to be able to teach that class. If we had somebody who was in a very compromised medical situation, that would be under medical advisement not to be out in public right now during the pandemic, how would we allow that teacher to teach virtually? I mean, at least to be able to accommodate them? Or are you saying that if they don't report to campus, then they don't have a job? That's what I think I want to understand very clearly.
Well, I think the challenge is all of those are going to have to be a case by case basis. And so it absolutely would depend on the severity of the situation. We have already made some adjustments with some very, that we know there are very few choices for an individual. And so even though absent from that, we might have said this person needed to do it this way, we're finding a different way so that if students do come to school physically, that we would be able to have someone, supervise while someone else might need to teach remotely. So those exceptions can be made. I just want to re-emphasize that what happens sometimes is then that's so subjective to how someone may feel like this is qualifying me to be able to do that. And we have to look at it you know, obviously from the whole system and in comparison to what's in front of us. So we absolutely, I know we've already done some of those. But I wanted to also paint the picture that it could be, that it would put the campus in a situation. But rather than kind of, I guess, just predicting that, we would want the individuals to apply for the accommodation and let us work through it and see what we can do.
I appreciate that because I think what I am fearful of is that we get so stuck in objectivity that we lose the humanness of the subjectivity of people's situations. And, you know, ultimately these are human beings who are trying to care for their own health and their own needs. And to that end too, I know that for some of our employees, that both faculty and staff, that even if they themselves don't have a medical condition, they may be a parent, a spouse, a primary caregiver for somebody who is depending on them that may have a medical condition of their own. And so what kind of allowances are we providing to staff who would be compromising someone in their care significantly if they themselves were to become ill?
Yes, we've spoken to Dr. Escott about that, and he responded to that question with us here today. It would really need to be something very significant of the individual. It really does apply strictly to the employee. But again, are there some exceptions? I know for a fact of one case where we made an exception because it is an unusual circumstance. So anywhere, I want to convey as much as I can, any way that we can make those accommodations, we are going to work any creative way we can to find a way to work around those situations whenever possible.
And what's the best way for an employee to engage in a conversation about that if they feel like they do have an extenuating circumstance?
I definitely think that, you know, human capital, the department has had individuals reaching out to individuals that were looking at the documentation. But if the individual feels like they didn't have any, you know, kind of dialogue with the process, that I would encourage them to contact our human capital department so that they would be able to work through that. And if that, if for any reason that wasn't a space where they got a response, that I would ask them to visit with their supervisor, principal, or whoever their supervisor would be if it's not a campus employee, so that the principal could then get in touch with human capital. Because all of us want to work together to make sure that no one is, at a very minimum, not feeling like their situation isn't being allowed, like so they could explain their circumstances.
I appreciate that because I'm already starting to hear of, you know, onesies and twosies of people who are, you know, taking a leave or quitting because they have to put a family member that is dependent on them first. And those types of things break my heart. And I hope that we really will do everything we can to, like you said, be as creative as possible to make sure that we're taking care of the employee as a person, in addition to thinking about the greater needs of operations. I also want to ask too about a little bit more about virtual learning. I heard you say it very clearly when you presented to us earlier, but because I know that this probably is hands down the question that seems to be flummoxing and confusing families the most. We will have a virtual option available to any student that wants it for the remainder of the 20 to 21 school year.
For the remainder of the 2021 school year, virtual instruction will be available to parents throughout the year. Even if they come on campus and then choose to go back virtual, it will be available throughout the 2021 school year, absolutely, without doubt.
Great. Because I realize that some other districts are not offering that virtual option. That is something that AISD is making a commitment to.
That is correct.
And with that said, though, knowing that over time we may see additional subscription to in-person learning as the year goes on, for those families that remain virtual, if they end up in the minority of students, of learners, you know, a few of our families are virtual than they are in person, how will we ensure that the quality of the virtual learning stays strong throughout the year?
I really think that as we move in that direction, should that come about, I think we definitely need to get feedback from the teachers and the parents so that as soon as they would be, because right now, I mean, it seems to be you're either having a great experience right now virtually, which I think I've heard quite a bit of. I've heard a lot of success that our teachers have just, I mean, what they've done and the hours they've worked. But I also hear from some parents that I don't know that it has anything to do with the teacher at all. It's just that our students don't all gravitate well to that, you know, that kind of learning. While on the other hand, I also know that I heard from some parents who thought this had actually helped their child come out of a shell. There was a story of an email I got from a mom who gave me that description because lack of the pressure of the social environment for this particular student actually provided a positive thing. So I think the minute that we stop communicating with our parents and we're not hearing, you know, I think it's going to require that we continue to do that and that we have plans, continue to provide the support to the teachers so that those the blueprints are available and that we're getting constant feedback. And then if we need to make other adjustments, I think we have to be very willing to tweak. If it becomes a very small group, maybe at that point we do pivot in a different direction to ensure that those students and families are getting exactly the best quality instruction, and that it doesn't begin to kind of wane because there are more students in person. So I definitely think as we move in that direction, figuring out how to not have the survey fatigue, but to continue to get, I think we'd have indicators that I'm measuring now, but what is the percent of students that are engaged on their computers? What is the percent of students whose teachers are reporting that they're engaged? I think that would be another leading indicator. If they're not staying engaged, then we're starting to lose them. And what do we need to do to provide teachers the support? But I'll absolutely make that a note of special attention to have a plan in place for that.
And to that end too, as far as, you know, that was the question about virtual learning, but when we get into the classroom in more of the blended learning environment, how will you ensure that first, like that there is coordination of those asynchronous schedules so that those teachers who are in a classroom are not trying to constantly be two places at once? And also too, how will you, what measures are being considered to be able to not overburden teachers with having to keep up with, I mean, because I know just trying to keep up with Blend alone and all of the links and the Zooms and everything that our teachers are responsible for, the double recording of things in multiple places, looking at our specials teachers, trying to keep accounting of attendance, you know, for all the students that they see in a day in Blend, student by student individually is very cumbersome. And so are there any types of process improvements that we're looking at that can start to make sure that the quality of experience for students in the classroom is strong, as well as the amount of extra effort that's being required of our teachers is minimized as much as possible?
Yes, ma'am. As a matter of fact, the teacher that I did speak with at length last week indicated, for instance, to your point, attendance seems to be I didn't even realize how huge this burden is on teachers because of the fact that students can actually be counted present way late into the day because the law allows, if they get online at 11:30 at night, but they weren't engaged during the day, they've been marked absent. But then if they do work and they turn it in, whether they get a good grade or not, we are supposed to count them as a present. Well, so that means teachers have to go back and make all of these changes to their attendance rosters. So part of the idea as well from this group of teachers was to inform us about what, hearing directly from them, what are those huge, the biggest pain points, because I did not realize how much the attendance was. I also then visited, just as I heard that, I asked a couple of other superintendents, well, what were they doing? Well, they had created a system where they've dedicated a particular staff member, like front office or another staff member, to work with the teacher. So the teacher doesn't have to do that, in a way in which the the staff members able to go in and make the corrections without the teacher having to do all of that work. So I think noting all of these things and then asking teachers for what they need us to do, and then us dedicating ourselves to finding ways to relieve that. Because again, the stress that teachers are under right now, we all know is tremendous. And so absolutely well noted, and I'll work with our teachers so we can create some processes.
Appreciate that. And then my last question too is when you talked a little bit about why all teachers are required to report in person, and you talked about continuity of our, students being able to stay with the same teachers, regardless of how things shift or change. That made sense to me at the elementary level, but I was having a harder time picturing how that will work at the secondary level where, a student may have one teacher that may have medical accommodations that may be learning from virtually. They may have some that are in person. So if we're talking about a pod model where the students stay in one classroom and learn on their Chromebook all day long and have basically a teacher who's there as sort of a proctor or a go-to person if they have a question throughout the day, then I don't understand quite as much how that makes sense in terms of all teachers reporting in person. The converse of that too is if we talk about having students report to the classroom for each subject teacher and change classrooms throughout the day, how also that would work if we had a teacher who was teaching virtually, those types of things. So if you wouldn't mind explaining a little bit more of that, that would be helpful.
So two things. Again, at the secondary level, while there's, again, 25%, we're not putting a classroom of 20. So you actually, at a minimum, bare minimum, need 50% of the staff at a bare minimum, because remember, at 25%, we're still talking about needing to put classrooms of 10 to 12 students. Separately from that, some of those are going to be very small pods of students that may still need to be pulled out separately from the way a campus may originally be deciding. For instance, if you have recent immigrants, or if we have students that have certain accommodations in special ed that are partly in a gen ed classroom, or in a regular schedule for the secondary level. So not knowing specifically how many students per class we're going to have, and then not knowing at each campus how many teachers we have approved accommodations, it seems that the best course of action initially would be for all of our staff to be there, especially to get accustomed to our protocols and our procedures while the number of students remains low, before we then explore some other alternate feedback from teachers with regard to how long should we remain in this model that I also think puts teachers in a very difficult situation of instruction on their own set, while students that are present are all on in different courses. But I recognize, again, the plan was designed, with feedback and prior to my arrival. And so I think gathering the data initially before we look at any of those changes, but I continue to recommend that as a team that we would all be on campus working through protocols and procedures so that we would all have the safest environment for our students.
I appreciate that. And my very last question, and I apologize for taking so much time of the meeting, but what can our secondary families, our middle school and high school families expect? Because when our students go back face to face, if they choose to do so, because I know we had a little bit of internal discussion last week about is a pod model more advantageous at this time than a changing classes model, essentially. And at what point in time will we be considering each model, and will there be a change over time?
So I think in general, and there could be others, but in general, I see 3 different instructional arrangements at the secondary schools. One would be where you have, which is the current design we have now, where students report and then they will be put into individual classrooms. A campus may decide to take all ninth graders alphabetical order, assign them a particular room, and they stay in that room throughout the day. That would be one arrangement. The second arrangement would be a pod model where you would have students, I'm in English 1, and so I'm in this room and the English 1 teacher comes to me, and all of us that are in this same pod also happen to be in geometry. So after the English 1 teacher teaches, another teacher comes in. So the students don't move, but the teacher comes and she teaches geometry or he teaches geometry. The third model is utilizing the student's current schedule. And what is advantageous for us is that because our secondary schools are on an AB block schedule, that means the number of rotations is actually half of what most high schools in the area are. Instead of moving 8 times, you would move 4, or technically 3, because you enter the building to your first class and then you would have 3 successive moves. You would go to your own classroom, if you will, of that you were assigned, because we're not all going to the same rooms, right? We all have different courses. Those are 3 main instructional arrangements. The second arrangement, which is kind of a hybrid between the two, the challenge with that is our high schools are so large in general that you would be talking about having to retool every single student's master schedule. And so when you look at the logistics, that really isn't feasible for a district our size or campuses our size. I do think that the teachers that I'm bringing in across the board can give us some feedback so that we also, before we communicate to parents how we may be adjusting what they're entering right now, would be something that we would have already, before we communicate to the parents, that we obtain some teacher feedback and teacher design, because they are at the classroom level and they may have something completely different than the 3 models that I've researched, that I've explored, because teachers in the classroom are the most creative people. So they may have a different way of doing that. I do think we have to commit ourselves that at some point, having students in one classroom all day long, having no connectivity either with themselves in terms of the courses they're taking and the teacher having a full load themselves, I don't think that's a sustainable model for the rest of the school year. So I would want to gather information and build a guiding coalition of teachers and principals so that we would then best communicate to parents rather than sending out mixed messages, as I know we've experienced previously. I want to learn from that experience and do a better job.
Thank you.
Thank you, Trustee Wagner. Trustee Ashe, and then we have Trustee Taish, Trustee Ellens, and then Trustee Singh. So we're going to be here for a little bit. Trustee Ashe.
Thank you. Some of my questions have already been answered, so hopefully I won't have to ask too terribly many. The first one is really more of a request than a question, and maybe it is the teacher in me, and I apologize for that. But if there is a place, or is there already a place that specifically speaks to the directions for changing from face-to-face to virtual and vice versa? So where would parents go to find the, I want to switch to virtual, I want to switch to face-to-face, and where would they find that? Is it already available, or is it going to be provided soon?
I don't know, but I am going to find out before we leave what our plan was for the request to change from one to the other. What I do know is we didn't want to do it during a week period of time because we don't want to create more change for a teacher who's dealing with a certain class. So I start Monday and now Tuesday, there's more students than there was on Monday. I mean, that might happen from attendance, but you would already have known these are the students that are reporting to you in person, not here's someone who's requested a change. So, but I don't know what that process is that the team created. I'm quite sure they're going to give us some information before we finish.
Great. And then I'm going to jump for just a second into pre-K. We were dabbling in that a little bit and saying that we had received information that discussed that once we are back to the face-to-face option, that we felt like there was a chance that more of our students would return, which I'm hopeful for as well. A conversation that we had in June, Dr. Elizalde, before you were here, which is why I wanted to bring this up, was around our teaching assistants and our ratios at the pre-K level, because the budget that we proposed did not include teaching assistants. And so we could have upwards of 18 preschool kids with one teacher. And as a preschool teacher myself, and in the interest of, at this point, even kind of playing catch up, trying to get our students back up to where they need to be and setting them up for success and learning to read. I was wanting us to explore that. That was something that we had said we were going to discuss again in August. And then life happened and COVID happened. And I understand why we needed to wait. And I'm ready to have that conversation again as we're coming closer and closer to face. So hoping that we can have that discussion sooner rather than later to discuss how we can support our pre-K3, pre-K4 with teaching assistants as numbers do go up, as I hope that they do. So I just wanted to bring that forward. Is that and ask and hope that maybe there are other trustees that would wish to have that conversation as well. Then the third thing that we thank you so much for being very, very clear about the online option for all year. I have had a few emails that have asked, and just for clarity's sake, they have heard a rumor, which there have been many of these over the last week, that those that choose to stay virtual are going to go to pass-fail. And I wanted to just hear from you directly whether or not that will happen. Will our students that choose to stay virtual have grades, or will they be moving to a pass-fail model like what we saw in the spring?
Everyone will have grades, whether they are in person or remain remote.
Perfect. Thank you. And then my last question is actually around our teaching staff. And I think it's safe to say, no matter where we are in the United States and the world, that the professional teacher expectations and realities has changed forever. And there may be those teachers that just really are in a space where they cannot make the decision for personal reasons, whatever those may be, to teach in the classroom in the traditional way anymore. And I was wondering if you could speak to the status of their teaching certificate should they decide that that is not something that they can continue to do.
I think knowing that this is a pandemic, any teacher that is struggling, knowing how much they really want to do this work, that we absolutely will not be holding on to anyone's certificate, which the most we could would have been the rest of the school year, but we will not do that. And they're completely eligible and encouraged to reapply the following school year if they so chose to want to still engage with us. And I would also ask some of those if what they could do is, if they needed to take leave rather than resigning for the rest of the school year, that might also be an option that they could work through human capital. Again, just looking for different options as opposed to completely disengaging with the district. If that was something we could work through, we would absolutely try to do that. But I want to reiterate, this is a pandemic. Nothing is normal. At a very minimum, the least we can do for our teachers would be to make sure that if they chose not to come back, we would absolutely not hold on to the certificate, not do anything in a negative way at all.
Thank you for that. And again, thank you to my colleagues for asking excellent questions that I don't have to repeat them. So thank you, Dr. Elizalde.
We do have there's a request that's mentioned on the Open for Learning plan for parents, and that it's a 5-day expectation if you're going from virtual to face-to-face. However, if you're going from face-to-face to virtual, that can be done that very next day, because that's a different impact on the social distancing with bringing students in.
Thank you, Trustee Ashe. Trustee Chaish.
I've had some teachers express an interest in being part of this teacher group that you've mentioned. Can they reach, who could they contact about possibly participating in that?
They could reach out to Rosa Palacios in
Rosa
my
Palacios?
office.
Okay.
Absolutely.
Okay. And then secondly, have you and your staff given consideration to the request for the hero pay at 2 times the rate? And could you comment on that?
So if I could pay everyone 2 times the rate, I would absolutely do that. I think everyone, and if I haven't said it, I want to reiterate, this is certainly not the ideal way for a superintendent to have to begin in a district with these decisions, knowing that they are really hurtful, regardless of what our intent is. However, as we all saw the summaries of our finances, there are 2 things that come to my mind. One is that we have a lot of employees who have been reporting now, and we're having, our teachers coming back October 5th. So the delineation of being able to pay that level of monetary support, I believe we did do a rough estimate, and we would be below the policy requiring in our fund balance, because we'd have to go into fund balance to pay that kind of salary. And that would put us below the board policy of having the 30% required. Or 20% that's required. We would be below that on that slide that Mr. Throm showed us. And so as much as I know that they're worth every penny, the long-term implications would be that we would truthfully, we would go insolvent, and that then we're talking about no one having a job. And so it's just a very, very challenging place to be. And if it were something that we could do, I assure you, I would be saying, let's do it. It is not something that financially would be sustainable and would affect our entire district.
And have you considered just the possibility of just doing classified heroes pay?
I'm sorry, I couldn't hear.
Have you considered just doing classified hero pay or heroes pay for a classified? Would that be feasible?
No, ma'am. It's not feasible. And we open ourselves up to quite a bit of litigation with regard to identifying what category, identifying the number of challenges with regard to that type of action. Professionally is not in the best interest of the overall organization.
So thank you from me, and I'm sure from the rest of the trustees, to all of our teachers and staff who are continuing to work under these conditions. As a former teacher, I can't imagine some of what you're undergoing, and we truly, truly appreciate you. I would recommend, as Trustee Singh did earlier in some of her remarks, that you begin your advocacy work with our legislators and with TEA, because they are creating some of the situations that we're facing here.
Thank you, Trustee Tice. Trustee Owens.
Thank you. And I'm also going to tag team just a little bit on what Trustee Singh and now Trustee Tyke said about the advocacy. I hope everyone is aware there are so many people and organizations out there who are fighting to dismantle public education every day. Please don't join the fight. All of us who are choosing public education, whether we live north, south, east, west, sending our kids there, choosing to work there, we are all on the same team. So this is a time to band together and really stay focused on our students. We're stronger together. Divided, we are destined to fail. And I just can't say that strong enough. When I watch the infighting, I really hope we can all breathe, trust, and work together as we try to get back to really educating our students. So having said that, I do have just a few questions. I too agree so many of the questions have been asked, so hopefully this is short. One of the things I'm hearing about are the safety of our actual school buildings. And I was wondering if you could talk a little bit about what our team has been doing with regard to the air quality, things like that.
So I know that we were looking to provide you, I don't think we have it completed right now, the assessments that were done with regard to that prior to my arrival. There were walkthroughs, each of the buildings is what I understand and what I'm being told. I do anticipate that report. I heard things like certain filters were being replaced, added, circulation in certain buildings. There were certain schools that as soon as I arrived came to my attention. I see Matias there to save the day. Mr. Segura is here. So I'm going to turn it over to the problem solver and the innovator, Mr. Segura.
Thank you, Superintendent Elizalde and trustees. Thank you for the question. Trustee Allens, we've been working very hard for quite a long time to make sure that our facilities are equipped to support our students and staff. Starting well over 3 months ago, the operations team actually started working closely with campus principals to develop operation plans. Now, the purpose of the operation plan is to think through every element of a campus. Where are we going to include signage? Where does a health screening location need to be? Where should the holding room be? If we need to replace water fountains with water bottle fillers, how do we go about accomplishing that? Kind of in coordination with that effort, we also had our service center perform comprehensive assessment and testing. And what that means is that they went through every building system and identified through various checklists and standard operating procedures, a check of every system. Is the proper amount of air coming into the building? Is it of the proper quality? Are we having the proper air filters replaced? And if not, we need to go ahead and replace them. And so many of those things have been done, and we're well above 90% over total system checks. Some of the other things that we've also done is we've secured over 400 large air scrubbers. These are those really large air fans with HEPA rated air filters in them to really circulate and promote air in corridors within all of our buildings. And again, we have over 400 of those. We've also procured and have distributed over 400 smaller personalized HEPA air filters. These are really meant to support the administrative spaces as well as the health rooms. Those have all been distributed as well. And right now what our team is doing is going back, dotting the I's, crossing the T's, and just making sure that each and every test that we've developed has been met so that we are addressing climate, we're addressing quality, and we're addressing circulation. And so I think we're very well positioned. And Trustee Elizalde is correct. We have a lot of information. I've been distilling that down into a report that can be provided to the board for consideration.
Was that Trustee Ellens or Superintendent Elizalde?
Oh, sorry.
Got a promotion.
Elizalde, Trustee Ellens.
Better pay.
Thank you very much for that. I hope that gives some people some comfort too. And my last question really just kind of was triggered by one of the examples, maybe Trustee Ashe talking about pre-K kindergarten. Since we are opening it up first to those young learners, if every kindergartner in a class shows up or wants to come and the teacher can't have all of them in their room, what does that look like?
That looks like central office staff members are there to provide support until we find a workable solution. That's the reason why we are working with central office staff. We can't say we're a support and not be on campuses. We have to provide the support. Our teachers are doing this heavy lift. So the very least we can do is we're all teachers. We're in a classroom. And so our specialists, all of our employees that are at Central, we will be assigning them. We will know that though, because of the survey responses. So we'll be able to prepare and plan so that students will obtain the lesson regardless, and it will be consistent until we figure a way that would make the most sense with the number of students, because there are some classrooms, depending on the building, where maybe 16 students may be able to still be 6 feet apart, but there could be another room where only 12 would really be able to be 6 feet apart. So it's going to be, we're going to need to make adjustments, but we, again, want to make sure we're dedicated to the process of masking, social distancing, and hand hygiene. So we're all going to pitch in and make sure we support our teachers for the heroic work that they've done.
Thank you.
Trustee Ellens, I might just follow up with Matthias a little bit and just ask whether or not our $1 billion investment that we've made that has invested in schools, mostly in the east side of town, that those are probably some of the more safer or safer, I don't know what the right word is, are the safest with the most up-to-date technology in them or filtration systems. I don't know if you could speak to that.
Yes, thank you, President Rodriguez. One of the things that I believe I communicated to the board about 2 months ago was that most HVAC systems constructed prior to the year 2000 have systems that were built using or requiring HEPA 8 or HEPA 9, MERV 8 or MERV 9 filters. And so since then, and also within our education specifications and design standards, we've now increased that. So we're now using MERV 13 in all of our new designs and new HVAC improvements. So that is indeed correct, President Rodriguez. The modernization projects, the large HVAC improvement projects are requiring higher standards of filtration. One of the things that I often get asked is, why can't we just retrofit, MERV 8 and MERV 9 with MERV 13? And one of the reasons we can't always do that is because there is a requirement of airflow through a system. And if you put a restrictive air filter on a system, then the system begins to strain. So we're constantly trying to make sure that we have the highest quality air filter, but still can maintain the proper level of circulation. And most of those things are a delicate balance. So thank you for that question.
And for the public's information, remind me what MERV level you're at and the equivalent to a hospital, because I remember that you're at the same level in MERV as hospitals. Or
yes, that's a good question. So the MERV rating index goes from 1, which is very, very low, all the way to 20 and above. Even above 20, it's really hospital grade, surgical grade filter systems. One of the things that I also want to point out is that in most residential homes and just kind of most places that folks go, typically you would see air filtration systems that are around MERV 5 and 6, maybe up to 8. So I'm pleased to say that all of our systems are at an 8 or a 9, but all of our newer systems are a 13, which is really where you begin to see the hospital grade filtration systems. And that's where you see the term HEPA actually get introduced into the MERV rating system.
Yeah. Thank you. Trustee Singh?
Okay, so I have a few more questions that have come to mind. Could you, Dr. Elizalde, talk a little bit about, so school starts, back in person for teachers a week from today. How have they been prepared for the new environment? They gotten training, etc.
Yeah, there's been professional development, and there's been some video type training with regard to arriving. I also know principals have worked with their staff. Since teachers are currently providing instruction, principals have provided a variety of different professional developments. I don't know the exact, like how often each one of those campuses have done that. I do know that there has been, and I can certainly gather more specific information. And if there's a need for us to increase a webinar or a professional development or a training module, we can certainly turn and do that, very quickly, so that we would have the access for teachers that need additional or need training.
Are they, I know that I think it was Johns Hopkins that has a training course that's available nationally. Has our school district, are you aware of, have we taken advantage of that here or?
I
Believe-
can't speak to that right now. I would definitely need to get with the team to see what the entire professional development included for our teachers. I know that, again, when I was visiting with the team, talking about the reopening plan that had been prepared prior to my arrival, I know they had these types of outlined trainings, but to speak specifically to which ones they were, but we can certainly gather that information for you.
Okay, great. I know that that is something that has been a concern that has been shared with me by some folks. So I would really appreciate that. I guess another question is regarding, earlier you were talking about the applications for the medical waivers and accommodations. What happens with staff who have applications that are still pending on October 5th? Are they still, are they expected to come in, or can they stay home until their application gets reviewed? Or do you plan on having them going through all of them by then, that time?
I know our human capital department has been working overtime to get to those. Some of them may not have a response because we're still waiting for documentation from individuals. And then it also depends, Trustee Singh, on when the accommodation request was made. So I know Dr. Medina has been working with his staff on that, but let me turn that over to him.
Thank you, Dr. Elizalde. And I meant to say this earlier because I certainly think this context is important. Trustee Singh, we currently have about 60 teacher pending requests, and we have engaged with all of our employees. And as Dr. Elizalde has said, we're in the process of collecting documentation, from them. As you know, we started this engagement when we sent the staff survey back in July. And so this has been an ongoing really engagement with our staff, and you can imagine with the number of requests that have come in, we want to continue to work with them, moving forward. We have about 43 non-teacher requests that have come that are pending and are also in progress. So we believe that we will be able to move these on before that first day. It doesn't mean that we won't get any more, but we're processing them, Trustee Singh, as quickly as we receive them. And I hope that information is helpful to you. And Trustee Wagner also had that question earlier.
Okay, thank you. I must have missed that question. So when it was asked earlier. Okay, and the other question I have is regarding resignations, and Trustee Wagner mentioned this a little bit too. Do you have data on how many resignations we have received? I hate to talk about that, so negative. But, I've been getting emails like everyone else about this. And is it more than what we normally see this time of year?
Trustee Singh, thank you for that question. And actually, I was reviewing that data just this past week. So I think it's important for us to look at it in context of the same time period. So looking at the same time period over the last couple of weeks, last year we saw 10 separations, and the reasons that were provided were varied. This year, as of the end of last week, we were at 23 separations and resignations. So we know that we've seen an uptick. However, I want to say this, Trustee Singh, that in general, though we're still below the overall resignations and separations that we saw last year. We'll continue to monitor that, and I will be providing Dr. Elizalde information as we move into the reopening.
Okay, thank you for that. And I want to echo what Trustee Teich said earlier about just having so much appreciation for our teachers and our staff. And, if you're thinking about resigning, it does, I think for all, I don't want to speak for everyone, but knowing the other trustees as I do, I'm sure it makes all of us really sad to hear that. But people have to do what is best for their families. So I just appreciate our HR department for working overtime to process all of this and keep as many people here as we can. So one other issue that comes to mind, Dr. Elizalde, earlier you were talking about there might be situations where if you have already had to accommodate a number of health waivers, at a certain campus, then you might not be able to do a lot more because you need to have staff at a campus. And so I see that. I do think about the equity in that as well, because we have some campuses that are already understaffed, and so that puts a little bit more pressure. I don't know if that puts a little bit more pressure um, to reject medical waivers for those staff teaching at that campus because maybe you don't have enough staff there to begin with. And that could also be compounded because I'm guessing we have campuses that have generally have higher percentages of Hispanic and Black teachers. And we know that because of our inequitable healthcare system, oftentimes those are the very same people that are at higher risk, medically speaking. And so you might see more applications for medical waivers from some of those campuses than others, which could also lead to more possibilities of denials, if that makes sense. So I just kind of wanted to share that and see if you had any thoughts on how we can ensure that the medical waivers are being granted equitably across our campuses.
Yes, and I think another trustee, I think it was, I don't know if it was Trustee Ashe or Trustee Wagner, suggested that we look at the district as a whole. If there are some conditions like that where maybe a teacher from another campus might be able to move to a different school where maybe that accommodation wouldn't provide the same level of hardship on one campus versus the campus they're at. So again, from an operational standpoint, I think there's some things we can do to continue to be as flexible as we can be. We have to keep our minds open and thinking differently. And I feel very encouraged at the number of teachers that positively responded to wanting to help me with this continuation of gathering feedback. I think they will be able to provide us a lot of different perspectives that we have not thought of.
Okay, thank you. And then the one other question is regarding, I've been getting some emails about nurses on our campuses. So I just wanted to get just some feedback or information from you on, do we have nurses at all of our campuses? And what happens when a child has a fever and might be suspected of having COVID? Do they stay in the same room as, in the nurse room, or is there a separate room for that? And then who staffs that room?
So we do not have a nurse at every single campus. We do have nurse availability at a neighboring campus with some designee at every single campus. I will be looking at that this coming year with regard to staffing, just to see what opportunities may present themselves to see that campuses, I would like to be able to explore the possibilities of expanding the nurse allocation to our campuses if possible. With regard to students, we do have a process that is outlined where students, depending on if it's when they come in at the temperature check. I don't know, I know Alexandra Copeland was available. I don't know if she's still on. If she is, I know she can be very articulate with the way in which we are managing students on a campus. And there she is. So Ms. Copeland handles, and really we're very fortunate to have someone who's worked directly with Austin Public Health to join our team. And so I'm gonna let her explain when a student does have symptoms, what the process is at a campus level.
Thank you, Dr. Elizalde and the trustees. So we have a process right now. So every single campus is going to have a staging room, which is essentially the isolation or the waiting room. So what will happen is during screening, if there is a student that doesn't pass the screening and their parent or guardian is not available, or it's during the school day where a student may start to exhibit COVID-related symptoms. They will be sent to the health room and they will be evaluated by health room staff. So the health rooms, we don't have a full-time RN on every single campus, but we do have full-time health room coverage. So it's either an RN or a clinical assistant that's monitored by an RN. So that has been taken care of. And we also have a sub pool this year, which we're really excited about, just in case an RN or CA is not available. And so they will evaluate them, and they will be using the Texas Medical Association screener tool for COVID-19 related symptoms. And if it's determined that they are symptomatic, then they will be sent to the staging room to wait for a parent to come. And so the staging room will have markers on the floor, social distancing will be implemented, everybody will be required to wear masks, and each campus will have monitors on the outside of those rooms, and that could vary by campus. So it could be the school nurse or the CA if the staging room is close to the health room and that nurse doesn't have somebody in the health room at that time. It could be somebody else. They will stay on the outside and they will be fully covered with their PPE just in case they have to go in. And then that health room staff is there for emergencies and any health concerns that end up arising while they're in the staging room.
Thank you. Okay, I really appreciate that excellent description. So it sounds like we do have some sort of like an RN or a CA. What's a CA? I'm sorry, clinical assistant? Okay, so we do have some medical staff at every campus.
Yes.
Okay,
correct.
got it. Okay, and then are TAs or teachers going to be asked to also help with supervision of students who have COVID symptoms or in a staging area or anything like that? Or is it just the RN or CA?
So it will vary by campus again. So what we want to do, and we don't want any staff to have to take care of a student that has COVID related symptoms, right? So we don't expect them to evaluate any of those students. And so with the staging room, if there is a TA or another staff member that is designated to monitor that staging room, that's exactly what they'll be doing, is just monitoring the staging room from the outside. So they won't even be required to go into the staging room. Again, if there are any medical or health concerns that arise, the health room staff will be notified immediately to come in. And just to make sure that those staff feel safe and protected, they will have a mask, a shield, a gown, gloves, everything. So even if they're not going in the staging room, if something happens where they feel the need that they need to go in, they are already completely protected with PPE.
Okay, great. Thank you so much. I just had another question for either Dr. Elizalde or Dr. Medina to clarify. Thank you so much, Ms. Copeland. Appreciate that. And that was to just go back because I was checking my notes. So I know that you're trying to get all of the medical waivers processed this week before next Monday, but just to clarify, if it's not done by Monday, is a staff person expected to come in?
I would want to look and see when did they submit the request, and I'd still need to see what the request was. So I think at the very least, we will touch base with every single person to tell them, where we are on that process. Dr. Medina, is that something that your team will be? I know you all have been working overtime, but will you be able to do that?
Absolutely, Dr. Elizalde, and our goal is to really work with them clear up to the 11th hour, to be honest with you, Trustee Singh. That's been our goal.
Okay, thank you so much. Appreciate all your answers.
Thank you, Trustee Teish.
So I had a question, Dr. Elizalde, about central office staff being deployed if needed Monday the 5th, or how long will that go on? Is that going to be on a day-by-day basis? And because these are people who have their own jobs to do, and particularly in our tech support area, they are spending a lot of time already working with teachers and campus staff on tech issues and tech support. So how do you, people can only do so much. So how do you anticipate working that through with central office staff relieving or supplementing with what we might have in the way of absences on campuses?
So the tech support group would be a group that I would not be pulling from. That should be a group, and that we're following up on, that there's a concern and a need for that department to have support. So that's already been put to our staff today to provide me some recommendations on how we can provide support. So the idea of central staff isn't that every department has to equally participate. It is about those of us who have a more of an opportunity. If we're working on curriculum, but the curriculum's already in development and some other people can continue that work, then that would mean me as a specialist, I would need to be out on a campus. So I'm really looking more heavily at the curriculum and instructional side of the house, where in general, we also have specialists who provide teacher support and coaching. Well, that's in fact some of the work that we would be doing, but we'd be providing some services directly to students. So I think those individuals who already have that as part of their description that they would be out on campuses would be the first level. And it would be just dependent upon how long we see this need, if it's someone that we think is returning, or if it's just a room arrangement that when we find a better space, we wouldn't need the assistance. So I'll have to be doing that on a case-by-case basis. But I absolutely commit that we will not be pulling from our technology.
So have the staff who will be affected, have they been notified yet, or not? When will they be?
So there was a list that Dr. Medina prepared for all of us in all of our departments, and we were to begin communicating with our staff. So I don't know which department leaders have actually made it through their list of individuals that will be working, but I will make sure we get that done.
Thank you.
Trustees, any other questions? I have one real short one, which is probably for Dr. Medina, about when you do these accommodations for teachers and for staff, how long are they approved for? Is that a annual review? Is that just during COVID?
Yes. So first of all, I do want to say, yes, it is. We know that FFCRA was available through the end of December, and our hope was to try to be as flexible as we can with our staff until that point in time. One thing that Dr. Elizalde mentioned earlier today was that we know that we have to serve students. And so we do know that we're closely monitoring those requests for accommodations. And to the extent that we can continue to be flexible, that's what our goal is. I think at the end of the day, if our parents decide that their child is better served in the school, then we need to relook at those accommodations on a case-by-case basis. And we're not there yet, Trustee Rodriguez. However, we do know that we're here in service of students. And so to answer your question, it really will depend on whether we're able to implement our instructional model. As Dr. Elizalde emphasized earlier today. So I want to be optimistic and say that we'll be able to lift it. However, we're going to be monitoring very, very closely as we, phase in students in 25 and 50%. I hope that answers your question.
But currently, Dr. Medina, correct me if I'm wrong, our application for accommodation indicates that this is good through December of 2020.
That is correct, Dr. Elizalde.
Okay, and so President Rodriguez, trustees, just to be clear, so and many of these are things that surrounding school districts have indicated to me that they approved early on many accommodations, and as students increased in the number that were choosing in person, they had to go back to their accommodated lists and start with the least, the ones that had, let's say, not as major issues, and had to go and have conversations, because on the accommodations form, it does indicate that it can be revoked if the need of the campus changes. So I want to emphasize it because we've started later than everyone else and went virtually later than anyone else. We will probably have very few, because we're ramping up 25 to 50. We will probably have very few that we will have to do that with, if at all. So I do want to be clear in answering the question. It says until December of 2020, and we're going to work as hard as we can to keep true to that and not have to ask someone to come back. But I need to put it out there because in case we end up in the situation, we may have to do that. We know what turmoil that creates. So we're going to work we're going to work as hard as we can to make sure we can avoid that. We will.
Thank you. I appreciate the thoughtfulness and the compassion behind that because I think that's a really important as we continue to support our teachers and our staff. Trustees, are there any other questions? If not, we will move on to item number 5. We have game changers. We have 3 recognitions to present. The first recognition is for Hispanic Heritage Month. And Dr. Elizalde.
Thank you, President Rodriguez, trustees. Each year, the United States observes National Hispanic Heritage Month from September 15th to October 15th by celebrating the histories, cultures, and contributions of Americans with ancestors whose ancestors came from Spain, Mexico, the Caribbean, and Central and South America. In Austin, over 55% of our students identify as Hispanic or Latinos. Thousands of our teachers and other staff members also identify as Hispanic or Latinos. And we celebrate our Hispanic heritage. We want our Hispanic students and staff to feel pride in their accomplishments, pride in their history and culture, pride in their families, and pride in their names and identity. Many of our school buildings are named after prominent Hispanic figures. Each year, we celebrate hundreds of high achievers in academics, fine arts, leadership, and athletics at our Latino Academic Achievement Awards event. I believe you all celebrated that in the spring. Our graduation rate has been steadily climbing for all students, recently reaching 91% for our Hispanic students. And each year, we see Hispanic students speaking on stage at graduation as valedictorians and salutatorians, often thanking their families in Spanish. We celebrate the gift of being bilingual, bicultural. 58 of our elementary, middle, and high schools offer a Spanish-English dual language program. Approximately 11,500 AISD students are enrolled in a Spanish language class in middle or high school. Last year, 519 students earned college credit by scoring high on a Spanish advanced placement exam. Austin ISD usually has a large event to celebrate Hispanic heritage that everyone looks forward to, but it's been a little different this year. So this year, our multicultural engagement coordinator, Norma Garza, who is just incredible, I know you all know her well, coordinated a virtual event instead. On September 15th, the Orgullosamente Hispano, Proud to be Hispanic campaign was launched on the Educa Austin Facebook page. We have received various entries, including various dances and art. We invite everyone to join this talent show. October 15th, the ceremony will be held on Facebook Live to announce the winners of this talent show. The winners are picked by the Austin community and beyond. Enjoy a little sneak peek of our talent show entries with this video of Eric Saul Bravo Rubio, a pre-K 4-year-old student at Barbara Jordan Elementary School. Eric and his little sister perform a traditional dance from Huasteca region of Mexico. She was done at that point, but bravo. Gracias a todas las familias hispanas que son parte de nuestra familia y enriquecen nuestra identidad hispana. Somos orgullosamente hispanos.
Gracias, Dr. Elizalde. Trustees, we're gonna, by the way, that was a great video. I think that young woman went to go get a mask. Our item 5.2 is the next recognition is a partner recognition for both the sponsors of our Back to School Backpack Bash and for Office Depot. Dr. Elizalde.
Yes, I'm going to ask Michelle Wallace to please do the honors, please.
Thank you, Dr. Elizalde, President Rodriguez, trustees. I'm here tonight to ask for formal recognition of the sponsors for AISD's Back to School Backpack Bash and Office Depot. First, we will recognize the Bash sponsors. Then we will recognize Office Depot. Finally, we'll watch a brief video thanking our supporters. This year's Back to School Bash was made possible by Austin ISD staff and community members who reimagined what the event could look like and helped expand its impact across the district. I want to recognize Christina Burbank from our Department of Communications and Community Engagement, who led this effort, went above and beyond to serve more students than ever before. We are grateful to the following sponsors. I'm going to share my screen, hopefully. A+ Federal Credit Union, Eric Case and OJ Gilder. We do have some folks that maybe stayed tuned in for this recognition, so we want to recognize them. AAA Texas, Kara Thorpe. Austin Board of Realtors, Carrie Weikart, Albert Allen. The Austin Ed Fund, Ron Reed. Capital Metro, Lonnie Stern. Colony Park, Barbara Scott and Liliana Ordonez and Laura Cortez. Cousins, Cross Texas Transmission, Sarah Chagnon. DBR, Edward Puentes, Brittany Hendrickson. The DJ Bling Foundation, Joseph Thompson. RBFCU, Robert Rodriguez. The Neighborhood, Jim Cannon. And Office Depot, Glenn Cromar, Logan Brown, Patty Salinas, Tommy Tricka. All right. Trustees, at this time, it is my pleasure to request formal recognition from you for the Back to School Backpack Bash sponsors.
Thank you, Michelle. Recognize Trustee Ashe.
On behalf of the Austin ISD Board of Trustees, it is my honor to recognize this year's Back to School Backpack Bash 2020 sponsors for their support and commitment to Austin ISD teachers and students. For the last 15 years, numerous Austin ISD departments have collaborated with countless community partners and local organizations to coordinate the annual Back to School Bash, which provides an engaging opportunity for Austin ISD students and families to discover important resources that help pave the way for a successful school year. Instead of the typical in-person event held at the Palmer Events Center, this year's program was reinvented due to the COVID-19 pandemic to instead focus on distributing backpacks and supplies to every Austin ISD school. With the support of our generous partners, Austin ISD was able to distribute backpacks to about 40% of the students who qualify for free and reduced lunch, which means over 17,000 Austin ISD students received backpacks, led by a $100,000 gift from Austin Ed Fund's Crisis Support Fund. Our partners pledged a combined total of $117,750 in sponsorships and donated in-kind gifts estimated at over $60,000, which included backpacks, school supplies, books, and personal protective equipment. Finally, many partners volunteered countless hours to prepare for and support back-to-school events across the district. These types of partnerships are to be commended, and it is with great pride that the Board of Trustees of the Austin Independent School District recognizes and thanks all Back-to-School Backpack Bash 2020 sponsors for their partnership and support of Austin ISD students and families.
Thank you, Trustee Ashe. And then I want to recognize Trustee Wagner to recognize the Office Depot.
On behalf of the Austin ISD Board of Trustees, it is my honor to recognize Office Depot for its support and commitment to Austin ISD teachers and students. In 2018, Office Depot launched their philanthropic community investment program, Depot Difference, which has partnered with Austin ISD since its inception. Through a Depot Difference program called Start Proud, Office Depot helps foster a brighter beginning of the year for schools. As a result of this partnership, Office Depot has now donated close to 3,000 well-stocked backpacks to students and dozens of pallets of classroom supplies to teachers, usually through a celebratory assembly. Due to the COVID-19 pandemic, this year's event was reimagined into a drive-through distribution for families at Barrington Elementary School. At the beginning of this school year, every Barrington student received backpacks filled with school supplies to help them start the year feeling prepared and proud, while the school received extra materials for teachers and staff. Additionally, Office Depot also provided Hart and Pickle Elementary Schools with backpacks and supplies. Finally, the Office Depot team was instrumental in supporting the overall Back-to-School Backpack Bash 2020 by packing and delivering over 15,000 backpacks across Austin ISD. This type of partnership is to be commended. It is with great pride that the Board of Trustees of the Austin Independent School District recognizes and thanks Office Depot for their partnership and support of Austin ISD students and teachers.
Thank you. And thank you, Michelle, for all your work and the Austin Ed Funds Board as well. And
Thank you, trustees. President Rodriguez, we do have a short video to thank the sponsors.
Great.
If it's all right, we could show that
Yeah.
now.
absolutely.
Thank you.
I am proud to join a community that comes together to support our students in this year of unprecedented change. The supplies and services available to our families through the Back to School Backpack Bash and virtual backpack will help our students prepare for the new year as we all work together to adapt to our new normal. A big thank you to everyone who helped make this initiative possible.
The annual Austin ISD Back to School Bash went virtual this year, distributing over 17,000 backpacks to campuses across the district. The Austin Ed Fund sponsored the Back to School Backpack Bash with generous donations made through the Crisis Support Fund from various sponsors.
Thanks to all of our donors, and especially to our friends at Office Depot, who have gone above and beyond this year to make sure so many of our students have access to school supplies and are prepared to start the school year.
Thank you to the Colony Park Neighborhood Association.
Thank you, Austin Voices for Education and Youth.
Thank you, A+ Federal Credit Union.
Thank you, DJ Bling Foundation.
Thank you, Capital Metro.
Thank you to the neighborhood.
Thank you, RBFCU.
Thank you, Safe Routes to School.
Thank you, Cross Texas Transmission.
Thank you to the Austin Ed Fund.
Thank you, Ascension Bell Children's Kids and Cars.
Thank you, Austin Board of Realtors.
On behalf of the City of Austin, I want to say thank you to all the local Austin organizations and community partners that contributed to the success of the 2020 ISD Back to School Backpack Bash.
So thank you again for partnering with the district to ensure every child is ready for school.
For accumulating supplies and stuffing our backpacks.
As a teacher myself, I know the importance of having the materials you need when you're ready to learn.
We're going to have a great school year because of you. Thank you.
I can't thank the hundreds of organizations enough for all their support of the Austin ISD's Crisis Fund. All of us at the Ed Fund truly appreciate it, and to see the community turn out to help our learners is a powerful inspiration to us all. Austin, Texas is one of the world's greatest cities for learning, and with your support, Austin ISD students will continue to excel. On their behalf, again, thank you so much. Be well, stay safe, and have a spectacular school year.
Thank you.
Thank you.
Thank you. Gracias. Thank you. Thank you, ASD. Thank you.
Are you going to introduce your special guest, Michelle?
This is somebody who's should be in bed right now. I'm just so proud of him for being quiet during that whole video. There's no way. Thank you all.
Thank you, Michelle. Our last recognition tonight is for Riley Elementary School, which was recently named a 2020 National Blue Ribbon School. And Dr. Elizalde, can you introduce our special guest?
I certainly can. This is one of those really great times to be the superintendent of Austin ISD. Thank you, President Rodriguez. I am so very proud of our Riley Mustangs and honored that an Austin ISD campus has been recognized through the National Blue Ribbon School Program. Riley is one of only 367 schools across the nation to receive this honor. Riley is one of the first multilingual elementary schools offering English, Spanish, and Mandarin. This award is a testament to the commitment from the entire Riley community to prepare students to be ready for college, career, and life in 3 languages and cultures. With that, I am proud to introduce our guests that are here with us tonight. Of course, the Riley Mustangs fearless leader, Principal Corrine Sines, and her principal supervisor, Dr. David Kaufman, and Associate Superintendent of Elementary Schools, Gilbert Hicks. Mr. President, I will turn it back over to our Board of Trustees for the statement honoring Riley Elementary School.
Thank you, Dr. Elizalde. Trustee Teich, do you have a statement to read?
Yes, on behalf of the Austin Independent School District Board of Trustees, it is my distinct honor to recognize Riley Elementary School, named the United States Blue Ribbon School for exemplary achievement, for being among the highest performing schools in Texas in closing achievement gaps, and to congratulate and recognize Principal Corinne Sines and the outstanding teachers, staff, students, and families at Riley. Riley is known for its language programming that is very inclusive, all students participating in either Spanish or Mandarin in addition to English. It is an additive approach that values students' language, culture, and heritage while providing equitable opportunities for developing bilingualism and biliteracy, grade level academic achievement in 2 languages, and multicultural competence. Riley is the first public multilingual elementary in the Central Texas area. Culturally responsive learning and awareness fits in perfectly in the Riley learning environment, where students and families from all walks of life and backgrounds pursue student achievement while valuing language, celebrating culture, and honoring heritage. It's with great pride that the Board of Trustees of the Austin Independent School District congratulates Riley Elementary School for being named a 2020 National Blue Ribbon School. Go Mustangs.
President Rodriguez.
Yes.
If you would allow me to turn it over for a moment to Dr. Kaufman, please.
Thank you, Dr. Elizalde, and thank you to the board for the recognition of Riley Elementary School. Very proud of the work that they do at the school. The community works together to support the school. The staff and the principal are dedicated to high achievement for all their students and providing a welcoming and safe environment. And the students work hard and are proud of the work that they're doing. This is one of only 367 schools recognized nationally this year as a Blue Ribbon School, and one of only 28 in Texas. So it truly is a very special honor, and it's well-deserved because of all the hard work that they do. And I'd like to just highlight the fact that they truly do implement some of our strongest and best AISD programs, including dual language, social emotional learning, cultural proficiency, and creative learning, as they are on their path towards providing a diverse group of students with really powerful learning results. I do want to just take pride for AISD and for the Riley Mustangs for the hard work they do.
Thank you, Dr. Kaufman. Dr. Elizalde, I think you wanted to recognize a few guests that we had
I
as
did.
well.
I know we've got some teammates that are going to be joining me, joining us October 1st. And so I wanted to see if Dr. Reach could find a way for Dr. Anthony Mays. And I'm not sure if Elizabeth Casas, there she is also available. Thank you all for getting warmed up to what our board meetings will be like. So with that, I just wanted to at least have you all get a look at Dr. Anthony Mays will be our Chief Schools Officer, and Ms. Elizabeth Casas will be our Chief Academic Officer. And so I just wanted them to at least say hi, and you all get to see them for just a moment.
Hi, good evening. My name is Elizabeth Casas. Thank you, Dr. Elizalde, and good evening, Board of Trustees. It is such an honor to come and join the Austin ISD team. I have 23 years of experience in education. I'm excited to bring all of that to Austin, and I hear the passion in everybody's voice, and I'm just excited to come October 1st and join the team and do the best that we can for kids. So thank you, and I look forward to working with you closely.
All right.
Dr. Mays.
All right. Good evening, everybody. Can everybody hear me?
Yes.
All right. Well, I too look forward to reintegrating into Austin, Texas. I am a Houston-Tillotson graduate, also a graduate from Texas State. So Austin is not a foreign land to me. I'm actually excited about, again, reintegrating into the community. My students, or my children, will also be hopefully, as I can find a home, a part of Austin ISD. So we got our bid on a house yesterday. So so it's plenty of competition out there, but I am looking forward to being a part of the community and us being able to grow and work together. So I'm excited.
Thank you both very much. And you can get rest now, but there will be no rest when you join us. So enjoy the sleep, because you all know that I think sleep is overrated. Okay. Thank you so much.
Welcome. We look forward to meeting you in person.
Likewise.
In the near future. Yeah. With social distancing, hand washing, and wearing of masks. So tonight, under the president's report, we have two items. The first one is really more about kind of where we're at as an organization. In the midst of this pandemic, the statement that there's no perfect answers rings truer to me now more than ever. And I think the board and the superintendent, it weighs heavy on us that people's lives are at risk, and that the school board and the superintendent matters in a way that I don't think any one of us could have imagined because of this pandemic. And there are no perfect answers here. And it's true that some kids are at home and now facing risks. And I think what I really appreciate is Dr. Elizalde's leadership in working with Dr. Mark Escott and Austin Public Health Department in making sure that science and facts are leading us through this pandemic. And in addition, getting input from the teachers groups, having the weekly meetings with Dr. Elizalde, with Dr. Escott, and keeping students centered at the core of everything that we're doing, including a compassionate approach to accommodations and flexibility around everything that we do. You might have heard this a little bit earlier in the session, but I think it's worth repeating that as I mentioned, some of our kids may not know where their next meal is coming from, and school is their only reliable source of food. Some are at home trying to learn on Zoom, while others are caring for their siblings because their parents can't work from home. I think all of us are faced, obviously, with the risk of this virus. But for some of us, well, actually, for all of us, that there's a risk of the virus. I think one of the things that I want to make sure that people understand is the tension we have between the ideal circumstances and what we're trying to accomplish in making sure that kids learn throughout this pandemic. And I think we've made it clear, the board has made it clear, the superintendent has made it clear that we are listening to individuals' concerns, to people's concerns, and all have a lot of valid arguments. And what we do know is that we need to have parent choice, but we also have to have choice and responsibility around following the guidelines that have been set out by Dr. Escott, the CDC, and other sources around social distancing, mask wearing, and washing hands. And the board, in meeting in person, is modeling the behavior that we're asking of our school community. And some of us are meeting in person while others are on Zoom. I think that throughout this pandemic, the superintendent has had the authority to make decisions about how we move forward, in part in partnership with this board and in collaboration with Dr. Escott. So one of the things I wanted to make sure is that we've received a lot of input about how the board has advocated authority, and we have been collaborating with the superintendent, and we have been working with the superintendent. So we haven't advocated one iota of our authority. And so while everyone's not going to be happy with all of the decisions we make, we have to make sure that we're protecting our most vulnerable in our community, whether it's teachers, students, parents, and the community members. And all that I ask of our community is to listen with open hearts and minds and consider the tensions between the absolutes that are being discussed as we continue to protect those with the greatest risk, and understand that not all of us will be satisfied, but there are no perfect options, but we are moving forward with facts, with communication, effective communication from the superintendent. I really appreciate that. I also just want to finish by saying that well, actually, that's the president's report. The second item is a board proclamation in tribute to Mrs. Waldron Ray Hill Plick, and Trustee Letitia Anderson will be sharing a proclamation for us.
Whereas the Austin community lost one of its greatest treasures with the passing of Mrs. Waldron Ray Hill Plick on September 18th, 2020 at the age of 85. And whereas the Board of Trustees of the Austin Independent School District wishes to honor the memory of Mrs. Waldron Ray Hill Plick for her service to the youth and families of Austin. And whereas Mrs. Plick attended Austin ISD Schools, Blacksher Elementary, Keeling Junior High School, and Old L.C. Anderson High School, and received her bachelor's degree in education from Houston-Tillotson College and her master's degree in education from the University of Texas at Austin. And whereas Mrs. Plick worked as an English teacher at Keeling Junior High School from 1961 to 1968, and whereas Mrs. Plick worked as an English teacher at Reagan High School from 1968 to 1974, becoming the first African-American teacher at Reagan High School. And whereas Mrs. Plick worked as an administrative interim at Dobie Junior High School from 1974 to 1975, and whereas Mrs. Plick worked as an assistant principal of Dobie Junior High School from 1975 to 1978, and whereas Mrs. Plick became the first female African-American administrator as the assistant director in the Department of Staff Personnel from 1978 to 1995, and whereas Mrs. Plick served her community for over 60 years of dedicated service as a volunteer, supporter, and mentor, and will be best remembered for her infectious but wicked sense of humor. And whereas after completing 34 years as a dedicated professional for the Austin Independent School District, Mrs. Plick retired in 1997. Now, therefore, be it resolved that the Austin Independent School District Board of Trustees hereby approves this proclamation as a lasting tribute to Mrs. Waldron Ray Hill Plick for her service to AISD community, its students and families, and for her many contributions that touch so many lives in such a positive and meaningful way. Approved on the 28th day of September, 2020.
Trustee Tyson.
I'd like to add a couple of personal notes. When I interviewed with the school district in 1979, it was Ray Plick who was my interviewer. And my husband, Randy, attended school with her daughter, Marilyn, at Reagan High School while Mrs. Plick was a teacher there. So I have a couple of connections with Mrs. Plick. And I wanted to hopefully and make a shout out to Marilyn Poole, her daughter. I hope she's watching this. She was expecting it a lot earlier, but I hope she managed to stay up to see the honor that we accord her mother, Ray Plick, for all the wonderful work that she did in this district. Thank you.
Thank you, Trustee Anderson and Trustee Teish. Next on our agenda is the trustee accolades and committee reports. And this is a new item for our regular board meeting. This item is for trustees to lift up some of the good work of teachers, students, and schools in the district. In addition, we will ask our board committee chairs and our designees on external groups to provide a brief update on any meetings or discussions of the committee. And we will start with our accolades. Trustees, is there anything you'd like to share? Trustee Tice, and then Trustee Letitia Anderson, and then Trustee Cindy Anderson, and then.
So I get to brag on another one of my schools, Barrington Elementary School. Was selected by West Ed to become a demonstration campus under formative assessment. The teachers embarked on a four-week summer professional development with West Ed this summer to prepare their formative assessment lab classrooms. The goal of the lab classroom training is to develop a coherent approach to formative assessment implementation across the Barrington Elementary campus, and to develop a shared understanding of how to leverage formative assessment practice to best support students to develop self-regulation skills and student ownership in their learning. Teachers also learn how to support AISD teachers and leaders who are new to formative assessment, and how they could best structure classroom and school visits to showcase the changes in the teacher and student roles. And hopefully we'll get to roll that out more on a face-to-face basis as conditions improve. But I appreciate our Barrington staff very much and the leadership of their principal.
And I have LBJ Early College High School is to be a part of the Apple Coding Initiative for the 2020-2021 school year. The Apple Coding Initiative is a partnership between AISD, Austin Community College, and Apple to promote computer science and app development to meet the needs of the current day workforce. Students at LBJ Early College High School will use hardware and software provided by Apple, and the Everyone Can Create curriculum to learn how to code and design mobile applications. The campus has received over $14,000 of hardware and materials to support the initiative. Over 40 LBJ students are part of the first cohort in this new program.
Trustee Anderson.
It is my honor this evening to share an exciting new partnership between Mendez Middle School and Texas Monthly. Texas Monthly has adopted the 7th grade Introduction to Journalism class. The goal is to familiarize students with the entire process of creating a magazine. From pitching story ideas to marketing and sales, Texas Monthly will offer monthly workshops for the students to try out all of the different and creative aspects of the magazine: art, food, travel, and everything that goes along with the magazine business. The students will also get a pen pal to pitch ideas to and get feedback from on their different assignments. Congratulations to Mendez Middle School staff and students for this exciting opportunity.
Trustee Matthias.
Many of us as trustees will be attending TASA TASB next week. It'll be virtual, but I just want to draw our attention to the fact that 6 of our students will have artwork that will be displayed as part of the exhibit. It'll be an online exhibit, and so we're excited for those students from throughout the district, and we'll be seeing their art next week at TASA TASB. Thank you, students.
Trustee Ashe.
I'm going to
Oh,
it this
sorry.
week, so I'm going this week.
I apologize. TASA TASB is this very week. We'll look forward to seeing those students' art this week.
Trustee Ashe.
I am excited to announce that the National Parent Teacher Association awarded Summit Elementary PTA with a $5,000 grant to help meet critical needs of students and families and teachers in their school community due to COVID-19. And with the grant, Summit PTA and the Summit Vietnamese Dual Language Program hosted a virtual mid-autumn festival with each student receiving a lantern kit and Vietnamese goodie bag to participate at home. On Friday, September 25th, this last Friday at 7 p.m., the students were encouraged to light their LED-powered paper lanterns and record their experience for a school-wide video. This is a national grant that only 14% of PTAs who applied were awarded the grant, with 14 local PTAs in Texas winning it. Summit and one other campus in AISD were awarded this grant. So go Summit Eagles. Not only are you guys flying, but so are your paper lanterns.
Trustee White.
Well, I get to be excited to announce that at Diane Goriski Middle School, the honors band was awarded as a national winner in the 2020 Mark of Excellence National Wind Band Honors Project. And so there were submissions from 38 states, and the fact that our Goriski students were awarded that national merit, I think is hugely significant and exciting. And I think I also wanted to just take a moment of personal privilege in that too, to brag on the directors, Nicholas Tia and Herson De La Garza at Goriski, and the great work that they do with our music students there. I had the opportunity to watch that honors band record one of their submissions. I'm not sure if this actual submission or a different one, but they played with such clarity and precision. And at the end of it, I think there's a few moments you get to see as a parent or even as a trustee where you just get to see that magic and purity of emotion that our teachers bring to their work. And at the end of the performance, Mr. Tia was so overcome by emotion. See, I'm getting choked up talking about it. He was so overcome by emotion that he had to stop and collect himself before he could even speak afterwards. He was so overcome by what his students had accomplished. And seeing that, I think, was so powerful and so emblematic of what our teachers bring to their work every day. So just wanted to call that out.
Thank you, Trustee Ellens.
So I would like to recognize all the Austin ISD educators who were honored for their innovative initiatives to connect kids to nature this summer. The Children in Nature Collaborative of Austin awarded the AISD outdoor cadre of teachers from 10 schools throughout the district who have committed to making nature equitable and accessible by promoting the use of school grounds as an extension of the indoor classroom, which is becoming all the more important during the pandemic. Specifically, I would like to lift up the following leaders in this endeavor, and I apologize beforehand if I mispronounce any names. From Austin High, Lawrence Sclerandi, Nate Rosenberg and Shelley Sellers from Small, Don Davis from O. Henry, Diana McMillan from Matthews, Matthew Armstrong from Rodriguez, Crystal Batty from Zavala Elementary, Jessica Cherry from Eastside Memorial Early College High School, Mary Ellen Gillum from Menchaca, Eva Rosenthal from Metz, and Hunter Willie from Covington Middle School. Thank you all for your creativity and commitment to our Austin ISD kids.
Thank you. Trustee Singh?
So seeing the need for frontline workers to be protected, students from the Austin Chinese American Network decided to do something about it. And using 3D printers in homes across the city, dozens of students from grades 4 through 12 got to work to make these face shields that look kind of like this. You may have seen people wearing them. And this was really, in total, they printed 15,000 of these face shields, 10,000 of which were donated to essential workers in local school districts. And this is really a monumental effort. So I'd just like to recognize some of the Austin ISD students from the Austin Chinese American Network who put their time and talents into this project. They are Lillian Fee, Yoonjin Park, Jason Wren, Robin Wren, Alan Zhao, Andrew Zhao, Justin Shu, Christine Tien, and Samuel Tien. So thank you so much to these entrepreneurial, tech-savvy, and community-minded students, and to the Austin Chinese American Network for your service.
Thank you, Trustee Singh. The Austin Latino Coalition hosted a personal protective equipment distribution event on September 19th at St. Elmo Elementary School, and staff from AISD, police, marketing, and community engagement, parent support specialists, and the superintendent helped pass out PPE and information about the district at the event. A second PPE distribution with the Austin Latino Coalition will occur at 9 a.m. to noon on October 3rd at Eastside Memorial Early College High School. The district's marketing team purchased 1,000 drawstring bags for each event to market the district's pre-K and early college high school programs. And I'll just add that the event on the 19th, there was so many cars that they had to stop distributing the student desks until later because there was such a backup of cars there. So in addition, the Austin ISD has again been named a District of Distinction by the Texas Art Education Association. The District of Distinction is an annual recognition program created by the Texas Art Education Association to honor school districts that are leading the way in the visual arts. And only the top 4% of districts in the state earned the recognition this year. The 42 winning districts will be honored as part of the annual TAEA conference held virtually this year, November 2nd. This is the second consecutive year for Austin ISD Fine Arts to be named a District of Distinction. So congratulations to the Director of Visual and Performing Arts, Alan Lambert, and to all our visual arts teachers and students. We will now move on to our committee and group reports. I'll begin by providing the report on the Board Governance Committee, and then I'll ask trustees for reports on various committee liaisons and committee chairs. The board's governance committee has been meeting virtually since April following the COVID-19 emergency resolution approved by the board on March 13, 2020. Consistent attendance has been registered by the sitting superintendent, including Dr. Cruz from April through the beginning of August, and Dr. Lizalde since August 6th. The board officers, the board's legal counsel, the chief of board and intergovernmental relations, and the board's executive assistant. The committee's focus has been to ensure the trustees are getting the support they need to serve the district during the global pandemic and the search for a new superintendent. As such, the committee centered its work from April through July around scheduling and planning for required board votes on the district's budget, the 2020-2025 strategic plan framework, the 2020-2021 audit plan, transfer appeals, policies impacting bilingual education, and the months-long process to interview and choose a new superintendent. The committee also focused assisting the district's COVID-19 emergency response around completing the 2019-2020 school year and celebrating the 2020 graduates, feeding children and families through the summer, acquiring technology required for online learning, and securing PPE for staff and student safety. Since July, the committee has shifted attention to stabilizing the district through the superintendent transition and supporting the administration's efforts to launch the 2020-2021 school year. And work has involved negotiating a separation agreement with Dr. Cruz and a contract with Dr. Elizalde, assisting the board in establishing expectations for Dr. Elizalde's internal and external community introductions and engagement, supporting the administration's recommendations to amend the school calendar, ensuring the board and administration are informed about the latest local health restrictions and recommendations and are using them as guidance in decision-making, and then scheduling board conversations to, in August, launch an equity assessment, monitor district safety and security reports, practices, and policies in September, finalize the district's 2021 legislative advocacy agenda in October, and co-create the 2020-2026 strategic plan scorecard and the 2020-2021 evaluation metrics from October to November of this year. Lastly, the committee is working together strategically to develop more consistent processes for scheduling future board meetings, developing meeting agendas, utilizing board docs more effectively, and streamlining communication between trustees and the administration. Trustee Taish, can I recognize you for an update on the Internal Audit Committee?
Yes, the Internal Audit Committee met March 27th, May 9th, June 12th, and August 28th. And during that time, we reviewed at first the draft audit plan for 2020-2021, and that was subsequently approved by the board at the June 22nd meeting. We also reviewed the third quarterly board report at the May 9th meeting and the fourth quarterly board report at the August 28th meeting. We also talked about the policy CFC local at our May meeting, and we were able to get that to the point where it was passed by the board at the June 22nd meeting, and that policy clearly identifies the internal auditor and trustee responsibilities for the Internal Audit Committee. At our August 28th meeting, we received our presentation by our external auditor, RSM US, and there were no major findings from that audit. That's also an ongoing audit, by the way. We also discussed potential investigations, and we received a briefing on KPIs and other districts' evaluation of directors. And the internal auditor will propose KPIs for the following meeting. We also received an update of internal audit implementation of peer review results, and that 2 of 20 recommendations are still outstanding. So we will have our next meeting on Friday, November the 6th at 11 o'clock via Zoom. And that is it.
Thank you, Trustee Taish. Trustee Matthias, do you have an update from the Legislative Committee?
Sure. Our board's legislative committee will meet tomorrow afternoon at 1 p.m. We're discussing our district's legislative priorities, namely the possible addition of 2 new priorities focused on accountability during the time of this pandemic. Stay tuned.
Thank you. Trustee Ashe, do you have an update for the Policy Committee?
Yes, thank you. We have met several times, and I apologize for not having the exact dates. We had initiated some conversations around the Student Code of Conduct, and after conversations with Dr. Elizalde, realized that there was some pre-work that needed to be done to examine some of our discipline practice and policies overall before we came back to the Student Code of Conduct. And so we have given that back to our superintendent to help give us guidance, hopefully in the month of December, January, as that moves forward. We also have discussed several policies as they relate to making sure they align with Dr. Elizalde's contract and her uh, abilities that were given to her and the signing of that contract. And so those will be coming to all of the Board of Trustees in an email form to provide feedback, should you so wish. And those are DC local, DCE local, DFFA local, DFFB local, and DK local. Within DC local, there will be some additional information provided around principals, the hiring of principals, and how we as the Board of Trustees will be notified on that, as well as a potential for an exhibit to discuss the functionality of the Principal Selection Committee. So please be on the lookout for those things in your inbox. Additionally, we discussed BED local, which is our public comment policy, and that is set to be discussed at the next information session so that we can potentially vote on that at the end of October with input from the 4 trustees, which would include bringing back our general comment that would allow people to comment on things that are not on the agenda, and as well as discussion on how we proceed under current safety guidelines that are set out by the state as far as not being able to attend in person for public comment, and how we will bring that into the policy as well should numbers change and we go back into higher stages and need to continue to record public comment. We also discussed EHAA, which is actually on the agenda tonight, and we did get a chance to look at that and did want to bring that forward for a vote this evening.
Thank you, Trustee Ashe. Trustee Singh, do you have an update for the Austin Partners in Education?
I do, thank you. So the Austin Partners in Education, they've launched a new website. It's austinpartners.org. You all may have heard about them because they're the ones that process the background checks for all of our volunteers, but they do so much more. API is a collaboration with Austin ISD, Austin Community College, and the Austin Chamber of Commerce. All of their programs have been adapted to provide remote support for students using district-approved platforms. API has 6 college readiness advocates and 16 Gear Up tutors that have been supporting teachers and students using Blend and Zoom at all 7 early college high schools since school started. And all of the API and AISD campus volunteer opportunities are posted on the austinpartners.org website. So anyone interested in volunteering this year can go to that website and see what opportunities are there and sign up. API's virtual math classroom, coaching, and virtual mentoring programs will be starting in October. And the one piece of exciting news is that API received a $450,000 grant over 3 years from the Greater Texas Foundation to support our work at Aikens Early College High School. So we're really appreciative of that. And last but not least, the API Board of Directors was very happy to welcome Dr. Stephanie Elizalde as the new Vice Chair for the board.
Thank you, Trustee Singh. Thank you, Trustee Singh. The final report I have is the report for the Austin Ed Fund. The Austin Ed Fund's annual Inspire the Future event will take place virtually at 10 a.m. tomorrow, September 29th. Video of the event also will be shown on AISD.tv on Friday and Saturday in English and Spanish. The event will welcome Dr. Elizalde to Austin ISD, honor the work of the AISD Crisis Support Fund, and celebrate all Austin ISD teachers, students, and families. The Austin Independent School District Crisis Support Fund has raised nearly $4.5 million thanks to the support of more than 700 generous donors. The Ed Fund recently announced 73 grant awards to teachers and campuses throughout Austin ISD. The awards, totaling $382,000, are part of the special grant program created in response to COVID and racial injustice. Proposals range from remote learning needs to innovative teaching strategies to cultural proficiency and inclusiveness, professional learning opportunities. The need is great. Teachers submitted proposals requesting more than $871,000. With this grant cycle, Austin Ed Fund has surpassed $1.1 million total in teachers grants. Trustees, any questions or comments? Nope. And if not, our next item on the agenda is a superintendent's report on an update on the first day of schools. Dr. Lizalde.
Thank you, President Rodriguez. This is just to clarify where we are with enrollment, which we did touch on during the first item. But I wanted to reiterate that we are under enrolled by approximately 5,119 students. And again, a very large portion, 2,718 of those students are pre-K3, pre-K4, and kinder. So that's greater than 50% of that enrollment is within those 3 grade areas. So we are working with our department to see how we can continue to engage more individuals. That being said, I again want to highlight some of the work that our teachers and our principals have been doing. On September 8th, the first day of school, I got to visit Principal Melissa Rodriguez and teacher Courtney Howe's ESL first grade classroom at Linder Elementary. I got to visit with Dr. Nathan Steenport and Mr. Brandon Hall at Doss Elementary. I also got to visit with Principal Ben McCormack and got to see some of the extraordinary work at St. Elmo Elementary. As I got to peek into a pre-K 3 classroom. We had Sylvia Villacorta, who was one of the teachers. I also got to see 5th grade, Joy Poole, and that was very exciting to see the partnership and the bookends of that school from their youngest to their upper grades. I got to visit and got a virtual tour of the Clifton Career Development School and visited with Mr. Tony Dishner. That was really incredible. I got to drop into LBJ Early College High School with Principal John Bailey. I also got to see Small Middle School, Principal Matthew Nelson, and got to see Miss Emma Renault teaching a Latin class, and that was really interesting. I also got to see McBee Elementary, Principal Yvette Celorio Reyes, and she shared a couple of teachers' classrooms with me. So I got to see Miss Vanessa Hernandez and Mr. Alejandro Basañez. I also got to stop at Covington Middle School virtually to see Principal Ty Choice. And then in person, I got to go visit Cunningham Elementary and Principal Heather Petrozzini. And I got to visit with our life skills students and teachers. And so it's been really rewarding to be able to drop in both physically and virtually into our teachers' classrooms and to see the amazing work that they are doing with our students. So kudos to everyone for making this work, and we'll continue to work on bringing you updates as we continue expanding our reach to our students and working to enroll a larger number and to continue to provide the quality instruction that our teachers provide. Thank you.
Thank you, Dr. Lizalde. Trustees, any questions? If not, we will move. Thank you, Dr. Lizalde. We will now move to a presentation of the AISD School Financial Integrity Rating for 2020. The state's school financial accountability rating system, known as the School Financial Integrity Rating System of Texas, or FIRST, ensures that Texas public schools are held accountable for the quality of their financial management practices and that they improve those practices. The system is designed to encourage Texas public schools to better manage their financial resources to provide the maximum allocation possible for direct instructional purposes. Dr. Lizalde.
Thank you, President Rodriguez. I'm going to turn this over to Larry Throm, our Chief Business Officer, and George and and I'm still going to mispronounce that name. Executive Director of Financial Services. I have to keep practicing all the variety of names. So let's see. There we go. I see Mr. Larry Throm there.
Yes, thank you very much. The first rating system, financial integrity rating system of Texas, the first one that we received was in 2002. So it's been 18 years that we've been receiving. All school districts have been receiving this rating. It's comprised of 15 elements. About half of them require a yes and no answer, and the other ones are sliding scale. The school district has scored 98, has earned 98 points on this rating system out of a maximum of 100, and that qualifies, the 98 does, as a rating, superior rating with regard to the questions that they asked for. And I would take any questions.
Trustees? So thank you, Mr. Throm. We will now move to the public hearing for school financial integrity results for 2020. This is the opportunity for the public to comment on the first report for Austin ISD, and following this hearing as required by law, we will disseminate the report on our website for review by the community in order to, actually, let me just check one. Dr. Reach, did we say we didn't have anyone signed up for this particular item?
That is correct. We have no one signed up.
Yeah, sorry. So since there are no one signed up, I will not read the rest of the format around the public hearing, but I will ask trustees if they have any questions or clarifications around the public hearing for school financial integrity results for 2020. Trustee Ellens?
Well, I guess I probably should have said this after the presentation since there were no comments, but I hope people are just relishing in this good news for just a bit. It is pretty spectacular that a district of our size can score a 98 on this kind of report. And so kudos to our finance department. Hopefully that will be one of the many elements that we will need to keep us solvent through this next year and keep us stable in our work. Thank you.
Thank you, Trustee Ellens. Trustees, any other comments? Trustee Ashley and then Trustee Tyson.
I just wanted to make sure, because I had seen a post that showed AISD featured quite prominently because of our credit ratings and how well we were doing managing our finances, and wanted to see if I had it correctly connected that that's what this was related to. Maybe not the 98, but the Moody, I think, or one of those.
Yes, that's correct. On a recent bond sale that we had of some $300 million, yes, the two rating agencies, Moody's, gave us, I think it was a triple A, a big A and two little A's, and Fitch also had a similar rating that they gave us, which indicates, the rating indicates to the people that are borrowing the money, or that are just buying the bonds, excuse me, the quality of the public entity who is selling the bonds to them, their ability to pay the bonds off to the creditors, and the school, the finances of the schools is one measure, but also we get our money from the community. So the financial rating of the community is pretty important to the bond buyers up there in New York and so forth, because they see what type of community it's growing. There's lots of houses and that kind of stuff. The infrastructure is constantly being updated, or at least talked about and worked on, and that kind of thing. So our rating is is kind of closely related to the community we live in, the city.
Well, thank you. And I would also like to say, and thank you to your predecessor as well, Nicole Conley, and all the work she has done. This is actually, I think, an evidence of both yours and her work together. So thank you to everyone who's made this happen. This is incredible. It's really amazing. And I'm excited to work with the district with this kind of a credit rating.
Thank you.
Trustees, any other questions? So if not, we will now move to public testimony for items on consent agenda and items for separate vote. This is the opportunity for the public to comment on items the board will be asked to take action on during tonight's meeting as required by law. In order to accommodate our video conference format, members of the public wishing to participate in the public testimony portion of our meeting called the dedicated AISD phone line in advance of the meeting and audio recorded their remarks. We will now play those recordings, so please listen carefully.
Good evening. This is Jared D. Brackenridge, and I am calling in regards to the item, the consent item that is talking about the innovative courses. The innovative courses that are being offered all across our district. There was a lot of very good, like, intentional investments as it relates to innovative courses all across the district. I was surprised about a few of them not being offered at certain campuses, but overall it was a good investment, I would say. In addition to that, though, the most important thing is reopening and school safety for all students and staff members. And basically, I am very concerned that we're not even having a public hearing about how our virtual learning has taken place so far and the whole reopening process. We should have a public hearing for that. In addition to that, I believe that we should not be tallying how many of our students and staff members have been impacted by COVID-19 due to our negligence by allowing, this plan to go through.
So thank you. This concludes the public testimony. We had one person sign up. Trustees, are there any questions or clarifications? If there is none, as a reminder to the community, please feel free to share any general comments or questions on non-voting items with the board by email at trustees@austinisd.org. We will now move to the consent agenda. Are there any consent items that trustees would like to pull for a separate vote? Trustee Wagner.
I'd like to pull item 15.4.
I'll second that.
Cindy Anderson. Any trustee Ellens?
Well, I need to let the trustees know that the administration has pulled item 17.1.
Trustees, any other consent items that trustees would like to pull for a separate vote?
I'd like to pull 15.3, please.
Is there a second?
Second.
Okay. Trustees, any other consent items that you would like to pull for a separate vote? Okay. Secretary Ellens, do I have a motion to approve the consent agenda?
I make a motion to approve consent agenda items 13.1 through 15.2, 15.5 through 16.2, and 18.1.
Second.
Trustees, is there any discussion on any of these consent items? Trustee Ellens?
Well, I would like to echo the praise from the caller for item, another item number. 13.1, the innovative courses. These have been allowed probably for the last 4 years, I'm guessing, something. It's been relatively new when we changed HB3, when that passed. And every year we've had 1 or 2. This is an enormous boost to our offerings for our students. And I'm just so incredibly proud of our teachers and our principals and our administrative leaders for getting this creative and this proactive. It's astounding. And I am very, very proud of what our district is doing and how they're now thinking to expand the learning for our children. So thank you for this item.
I just wanted to say, as it relates to that, like barbering, like, you know, little known fact about me, when it was Lanier, I went there for cosmetology. So I'm super excited to see that and anything healthcare related. Not to say that computer science doesn't matter, but I'm all healthcare. So I hope to see some of this in District 1. And I'm just super excited.
Thank you. Trustees, any other discussion on the consent agenda items? Hearing none, and having a motion by Secretary Ellens and a second by Trustee Cindy Anderson to approve consent agenda items 13.1 through 15.2, 15.5 through 16.2, and 18.1. All those in favor, please raise your right hand. Yep. The motion passes by all those on the dais. Now, for the items that were pulled from the consent agenda, do I have a motion to approve agenda item 15.4? I'm sorry. Oh, I'm sorry. I'm taking them in the wrong order. I apologize. Agenda item 15.3. Trustee
Second.
Ellens, and then Trustee Teish. So is there any discussion on item 15.3? Trustee Singh?
Yes, thank you. So I thought that we had voted on approving a budget calendar in August. Is that correct?
It got pulled from the agenda.
Oh, it got pulled from the agenda. Okay. Thank you for that reminder. All right. So I had a question. So in the version that we saw in August, even though it was pulled, there was a line in there that is not in this version. And that line says that the budget department coordinates with the equity office to align equity initiatives within the budgeting process. And that would happen throughout the whole school year from August to June. And so I just wanted to get a sense of maybe why that was removed and possibly moved to reinsert that into this budget calendar.
So I saw the question and I actually don't know why or when it was removed. I would need to see if Dr. Reach or Mr. Throm had a chance to look at that because I didn't get with them until late today. Let me see. Dr. Reach, do you remember about that line? Or when it was removed or why it was removed? Oh, there's George.
I'll ask George. It was not on the earlier one that was sent to us.
Yeah, Yes, so good evening. This is George Gomez, Executive Director of Finance. The budget development calendar that you see in front of you will only include statutorily required items and then items that we bring to the board. We tried to remove a lot of the other items, but that's not to say that we won't do them. This is just showing what is statutorily required or what items that are brought to the board.
Okay. Okay, thanks for that explanation. I appreciate that. I think, just thinking about our strategic plan and how we have recently spent a good deal of time, trying to have it reflect our current values and focus areas and how we have equity undergirding each one. If it's not too much trouble, I would like to see that reinserted into this if it's possible. So I don't know if any of my fellow trustees have any thoughts on that, but I think this would help us as a touch point. I imagine you would be working closely with the equity office, but I like to see it just kind of see it in our in writing, I guess. So.
Trustee Tice?
I would support the insertion of that particular item and just need guidance as to where that would go and what the language would be.
So I would suggest, I guess I could make a motion that we would use the language that was in the August board docs documents, and it just says budget department coordinates with equity office to align equity initiatives within the budgeting process, August through June.
15.4.
Can I just ask where that, no,
Oh,
in the documents from August, what line was that?
Oh, let me go back and look.
And we may have changed.
It was near the
format.
top.
It was
I do.
line number 5. Budget department coordinates with equity office to align equity initiatives within the budgeting process. Line 5.
So trustee Singh, I have a motion from trustee Ellens that was seconded by trustee Tice. So I think the one way to do this is by just asking the superintendent her thoughts about that. And secondly, if trustee Ellens is amenable to an amendment to that motion.
Yes, I wanted to ask Mr. Govanas if he could just, I just want to be clear that, and I know we're doing this along the way, but I want to make sure we're not doing anything that would impede the work that needs to be done.
No, not at all. This having it in August would align with the fiscal year. But as I mentioned, we tried to just include the statutorily required or items brought to the board. So that's why you're seeing a scaled down version as compared to the past.
But we have no objection to inserting that language, correct?
Correct.
Thank you.
So I would just ask my fellow trustees, the calendar they gave us in August and why they pared it down had 49 items. This one has 22. So I just would like people to discuss, I'd like to hear, I'm not sure, I think.
So let me just clarify. The motion you made, trustee Ellens, and was seconded by Tice is the one today with 22 items.
Correct.
I think in the discussion, trustee Singh mentioned going back to the original one. But since I clarified that there's a motion on the floor that you're the author of, if trustee Singh wants to add that language, just that language around that will, I don't know what the right word is, align, coordinate.
So I would be happy to entertain the amendment with the full board voting versus me changing my motion.
So let's vote on the motion.
The amendment.
The amendment. And then we can do that. Okay, so I need a second to that. Yes.
Yeah, I guess my question would be that
this is a calendar, but this doesn't outline the entire budget development process. So I think having a different document that partners with this, that explains the process, I think maybe another way to solve your concern, Trustee Singh, because as was previously mentioned by the staff, this is simply calendaring with respect to statutory requirements and conversations by the board, but it doesn't preclude equity from being part of any or all of that process at all. Because again, this is not descriptive of the process. This is simply a calendar. So for me, equity is not a calendar item, it's a process item. So I don't know if that's an alternative solution, but I think those two things go hand in hand, and I wouldn't mind seeing more of an outline or documentation on what the process is, which is where honestly I feel like the equity piece fits.
So
I think that's a question for Dr. Elizalde and her team.
that was sort of my question as well, because if, I think we're approving what's coming back to us versus what the work of the administration is.
Yeah.
And I'm not against the request. I kind of like what.
Because I feel like in every board discussion, that is a board priority. So it's going to be part of the conversation anyway. I'm not sure that, again, it's a calendar item, because then seemingly if we use that same approach with our other work, equity is calendared and everything, but it should be there anyway. Just a suggestion.
I mean, I think I guess maybe what I'm saying is I actually would like to have a present, you know, if this calendar in front of me is what it is presented to the board, I would like to have a formal, you know, equity type report at some point before the school year, you know, before we would vote on the calendar. So I mean, I think it probably, like Trustee Anderson was saying, I think it is part of the process, but I think if we don't have a formal sort of presentation, it's easy for it to not get the attention that it deserves. You know, and I guess I can give a quick example of why this came to my mind. It's like when we were looking at the number of vacancies in our Title I schools and how there were so many more there than in our other schools. It prompted us as a district to think about strategic staffing and other things. And that, you know, and so like, that's what I mean is like when we kind of formalize and operationalize an equity analysis into this plan, and maybe we do have one or two formal presentations set aside to look through that lens. It just helps ensure that we are reflecting our strategic plan priorities into our budget process and product.
So Dr. Elizalde, would it be better to have a motion that directs administration to incorporate equity into the calendar process, or would it be better, because what I hear in the discussion with Trustee Singh is asking the administration, asking you for a report on equity, on analysis of our budget based on an equity lens. And that seems to be more board governance than directing you to do something operationally.
Yes, as a matter of fact, today at our executive leadership team, Dr. Holly presented a list of 6 questions on how we prioritize when we're beginning our budget development within our departments, and how we strategically ensure that we are in fact being reflective of the needs after we do a needs assessment. So I think it would be great for Dr. Holly to come back with our finance team together and present. If that would meet Trustee Singh's request, then we could absolutely, and I'm excited to be able to do that. So then we would be able to leave 15.3 as is, and then we will bring forth at least one, if not more, presentation from the equity department and finance together on how they're training us. Because the finance department worked with Dr. Hawley on this design that that she presented to us today. So I think the board would be very interested in seeing that.
Trustee Singh, does that address your issue?
So are you saying that it would or that it would not be in the calendar?
I think what we're saying is that it wouldn't be in the calendar, but Dr. Hawley has already presented to Dr. Elizalde and her team around the budget, and they're actually committing to bringing back at least one, if not two, presentations about the equity work that they're already doing around the budget. So they're already doing, I think, what you're asking them to do, and the only question is they're committed to reporting that back to the board to have a presentation and discussion. Did I say that correctly? Yes. Yeah.
Okay, but we don't want to put that in the calendar. We're just saying that.
She may not be ready to dictate when that happens yet.
Okay. I mean,
So can I make a suggestion? So item 16 is the presentation of the 21-22 preliminary general fund. That is, that happens in April. And so I think by this conversation now, but we are directing the presentation to be presented to the board using the strategic plan framework lens, which is supported by equity. So I think that that's probably the board's responsibility to hold the superintendent accountable in that report, which is scheduled for April. So it wouldn't change the calendar, but it's background information for the superintendent to be prepared for that conversation.
could you tell me which line item that is? I'm sorry.
Yeah, it's item 16.
Okay. I'm fine with that. If we could consider I want to see the word equity on here. I guess that's what I'm saying. I want to make sure, because that holds us accountable. I know it's going to happen, but I just, to me, I like to see it. I mean, I kind of do a control F on pretty much any document we get to see if that word is in there, because to me, that's a signal that, and it helps trigger me so that I remember, okay, when that actually comes up on our agenda, that's when I get to ask those questions. So that, I mean, maybe we don't add another item, but we just insert something in there with number 16, like through an equity lens or something like that. That would be my preference, but if others don't feel strongly about adding the word equity in there, I can't do anything about that.
Trustees, any other comments? Thoughts, Trustee Tyson?
So I'm a little bit confused. So Trustee Singh, are you willing to make an amendment?
I mean, I am, but only if it's going to be, if I get a sense that it's, others are interested in it. I don't want to, hard to tell because I'm not in the room, so I can't see your faces. So yeah, I guess I will. I mean, I can make a motion to amend line 16 to add the phrase with an equity lens to the end of that.
Are you talking line 16 on this budget calendar?
Correct, line 16.
On the 15.
Is that, I just want to make sure we get fully covered, because the motion on the floor is
I'm sorry, I didn't hear you.
Oh, sorry, because I had this off. Sorry. I was asking for Christine's guidance here because we have a motion to approve agenda item 15.3 that Trustee Ellens made a motion and Trustee Tai seconded. And Trustee Singh has made a motion to amend it by adding language to 16.1. I'm sorry, to line 16 within item 14.3. Oh, I'm sorry. Then
15.3.
15.3. Sorry. I've got it now. Okay. So that's appropriate. I was just thinking it was an item 16. So, okay. So sorry. So if you're making a motion to amend then I need a second to do that.
Second.
So we have a motion from trustee Singh and a second by trustee Taish to amend line 16 under agenda item 15.3 to add the word equity. Is that right?
Through an equity lens.
Through an equity lens. All those in favor, please raise your right hand. Or I'm sorry, is there any discussion? If there's no discussion, all those in favor, please raise your right hand. Okay, so the motion passes. So agenda item 15.3 is now amended. So do we have any more discussion on approving agenda item 15.3? That was the amendment to 15.3. So now we're doing the motion to agenda item 15.3. All those in favor, please raise your right hand. As amended, yes, as amended. So the motion passes by all those on the dais. Thank you all, trustees. Do we have a motion to approve agenda item 15.4?
So moved.
Second.
Sorry, I was trustee Tice and seconded by trustee Letitia Anderson. Okay. Any discussion on item 15.4? Trustee Wagner.
I had some questions on this one because it seems like we're changing our kind of our funding model and structure around mental health clinic delivery. And I'm kind of curious to understand where this sort of pivoted because before we had a couple of partners that we'd worked with for the last several years who had developed quite a bit of bench strength and relationships and commitment with our students. Since those folks either declined to bid or pulled out of the RFP process, that was kind of curious to me. I'd like to understand maybe a little bit more of what happened there. The other thing I'd like to understand too is that the funding model that's contemplated here doesn't include any of the VOCA funding that we've historically used for our mental health clinics. So, and I'd like to understand how that fits and as well as what this new funding that seems to be coming out of M&O is funding as opposed to the VOCA funding. Additionally, I'd also like to understand too, because I wasn't able to find in any of the materials that we were given any background on capabilities of the vendor that's being recommended. In my own kind of poking around and research, I was only able to find that they manage 2 small clinics in Austin, but not that they've done anything at the scale of which we're asking them to do for AISD, nor that they had experience working with school-based mental health clinics before. So I'd just like to understand entering into a contract and completely pivoting from vendors that have been able to provide services successfully to this point and bringing that forward as $11 million worth of contracts for an initial 1.5-year term plus 3 additional renewal option periods seems like a pretty big jump. So I would like to get some more insight and understanding of where we are and how we got here. And also to what the composition of the RFP was that may have dissuaded our previous partners from participating.
So I know we've got Alexandra Copeland, and I don't know if I have anyone I'm hoping we have someone for procurement that can walk through that process. Ms. Copeland, could you join us? And I don't know if you heard all of Trustee Wagner's questions, mostly around maybe the process that was utilized along with maybe some information, if you have it, with regard to the vendor that we had been using that I was informed had withdrawn their application for this particular award.
everyone. I do have Heather Graves on the phone too. She is the contracts and billing manager within Health Services, and she really played an integral part in this RFP process. So I just want to state we have gone through this RFP process for about 5 months now. So it's been a very extensive process. We had 9 different evaluators on the team from all different areas. So we had somebody representing community members and parents. We had administrators. We had licensed mental health professionals. We had outside community members, financial specialists. So we really tried to look at this from all different angles. I know that there was a question about the financial model that's being used. So we actually switched to a fee-for-service model in June of 2019. So it's not a new model. And we ended up doing that because the previous model that was being used, and of course this was before I came and took over the department, was not sustainable. And so with the new model that we have been using, we've been able to save the district a significant amount of money and have been able to expand our services more. So that's the reason for that. And Heather's on here. I don't know if Felix also is on here to kind of add to the financial model and the finances behind it.
Hi, I'm Heather Graves. In regards to the financial sustainability of the program, that was voted on back in, I don't know exactly the month that it was voted on, but it was implemented in June of 2019 from a sustainability standpoint, meaning that we are now averaging about 71% of all mental health services are currently being billed to third-party insurance providers, with the remaining 29% of those direct clinical services being paid for by the district because those clients are uninsured. And so that was how we actually were able to make the program more sustainable long-term. The VOCA funding, the Victims of Crime Act funding, that is something we have an application in. We have not received confirmation as to whether or not we will receive any funding, but we have been told that it will be significantly less. We do not know for certain how much less. If we do receive additional funding through the Victims of Crime Act, we will continue to operate the program with managing the fee-for-service model in terms of victims receiving care and non-victims receiving care. And in that case, the district only pays for non-victims. And then all victim services are able to be routed through the Victims of Crime Act grant. I'm not sure if that answers your question regarding financial, Trustee Wagner.
It does. And I think my remaining question was around qualifications, just understanding what kind of, if this, well, and I think kind of one of the things that stuck out to me was that we ended up with only, for something that's an $11 million 4-year commitment that's going to serve thousands of students in our district, we're down to just one firm that met the qualifications and everyone else either dropped out or what didn't meet the min quals. And so that's why I just want to make sure that we're not going with a vendor that doesn't have the proven track record and experience to be able to deliver something that's critically important at our campuses that we have held true to as a strong value in AISD. I'm very committed to this program. So this is me coming out this in a very protective way of wanting to make sure that we have the right vendor in place to do this well. But since we only have one vendor left standing, essentially, that I can't seem to find much in the way of relevant qualifications for, I want to understand a little bit more on why you brought them forward as a recommendation as opposed to being able to examine other vendors.
So I can start that one off. So there are a lot of different angles that we looked at when we were evaluating, or when the evaluation team, excuse me, was evaluating this vendor. So we looked at the financial sustainability of the vendor. We looked at the clinical aspects of the vendor. And then we looked at the operational aspects. And then we also tried to look at this from an equity lens. And how do they train their staff, and how would it fit into the different demographics within the district? And we wanted to also make sure, one of the biggest things to me, my background's in public health and in mental health. And so that was very important to me to also make sure that we wouldn't have any lapse in services, and that we would have a smooth transition from one vendor to the next. And so some of the feedback that we had been getting from the district, and that we were moving towards, was that with the school mental health centers, we really wanted a vendor that would focus on direct clinical therapy. Because a lot of the other aspects of an ecological model, such as training and also serving students in that tier 1 and tier 2, could be provided from the district, from our counselors, SEL, our licensed mental health professionals. And so that was really our focus with this, because that has expanded greatly, right? And even in the midst of COVID, we know that the mental health needs are rising. And so we wanted to make sure that that need for our tier 3 and above students was being met. And so that's kind of what we looked at from this angle, all those different aspects of it when we evaluated this vendor. And so that's kind of the biggest thing there. And again, this has been a 5-month-long process. So if you can see, what was attached was the evaluation sheet. So, we had 9 different evaluators, and we had 2 phases of evaluation. So we evaluated the applications that came in, but also did interviews with the different potential the people that applied. And so both of the top kind of vendors that have applied were very close. And then we did have one drop out towards the end. And they had expressed a lot of support for the new direction that we're going in, and just being really supportive to the process, and wanting to really make sure that they're still serving students in the district and having that smooth transition. So we really made sure to look at all those different aspects. We even went as deep as to look at how they hire their therapists. What are the different elements that they hire on? What type of equity training and anti-racism training do they go through? What type of certifications do they require? What type of licensures are they open to? How quickly could they onboard with teletherapy and in person? So that was a new thing too, because before, our previous contract was just face-to-face teletherapy. And then now we have the service agreement with Vita Clinic that goes until December, and that's for teletherapy. So we really wanted to make sure that we had both of those to be able to increase that access to mental health care and expand for staff and students. So again, there were so many different elements that we looked at, and we really wanted to make sure that our evaluation team members were very, very diverse, so that we could get those different lenses from all those different angles. Again, Heather Graves was really instrumental in the process. So she definitely may have more, and I know she's a numbers person, so she has a lot of numbers for you too. Heather, was there anything you wanted to add to that?
Well, one thing that I have found interesting during this transition during the pandemic is that when we were operating strictly in a face-to-face therapy model, we were only we were only able to serve approximately, let me see here, I wrote it down, 40% of the district campuses. Now that we have been able to implement teletherapy, allowing the district to be open to serve all students across all campuses, we are now serving approximately 75% of our district through services. And in doing the evaluation process, we began the process in April, I think, Lexi, is that correct? And so we had already kind of pivoted to a teletherapy model with our current vendor. And so in organizing the RFP and the scope of work, we chose to implement and look at a hybrid model that allows us to continue to be able to serve the district through both face-to-face, if, when we are able to do that safely, as well as the teletherapy. And so I think that's encouraging.
But that's not really a distinction between the vendor that we have now, though, because the vendor that we have
No.
now is offering both. Correct.
No, that is correct. Lexi, the differences with
And maybe just jump in a little bit too, because I really appreciate all of the discussion around the approach and ways that you really wished for a mental health vendor to approach care for our students and their families with equity in mind, and all of those considerations, I think is fantastic. But the thing I think I'm still haven't heard that was really kind of the crux of my question was, when we're talking about the scale with which they will be delivering services for Austin ISD, which is a very specialized environment of a school environment. And I still, well, I have another question too, but let me finish this part. What kind of experience do they bring to bear of working with that large of a clientele, that many different distributed clinics, this type of community and clientele, and making sure that they have the proven track record to operate at this scale of a model? That's my primary question. And so because the thing I think that's still tugging at me too is, why did a vendor that we've worked with for 5 years that had delivered a strong enough performance level that we were receiving millions and millions of dollars from the state to support their efforts, why did they pull out of an RFP process after 5 months is a really odd thing to me. And I think I'd just like to understand if there's a little bit more context you could provide there, since we are in this kind of one vendor left standing position.
So with Gramercy right now, they have 2 in-person clinics here in Austin, but they are all over the state of Texas right now doing teletherapy. They actually offer services to some of our Austin ISD students currently, and they have also been in other school districts offering those services. So they do have experience providing teletherapy and face-to-face services with students in a K-12 environment. One of the things that we did do, again, we had a lot of back and forth emails and conversations. So we provided them real in-time data on this is how many students we have, but not only that, this is the average amount of encounters. This is the most that we've had in 1 month with face-to-face and teletherapy. This is what we're looking at. And so we tried to make sure that we were very transparent on our side on this is how much it's going to take. What is your capacity now to take it over? How long will it take you to ramp up to what it needs to be able to serve all staff and students? And so we have had those conversations. And we also have continued to have those conversations with VITA. I know in that board agenda item, it did list some of the issues that we have had in the past with VITA. I will say that since I've taken over the department in June, we do have weekly meetings with VITA. We do check-ins with VITA Clinic. I implemented the service agreement even before I took over the department permanently, to make sure that there were no lapse in services during the RFP process and even afterwards. And so we have kind of checked that on all different ends. I know that there were multiple meetings that had happened. A lot of it was around the financial sustainability, as well as that direct clinical therapy that we were hearing from the district on. This is what we need, and we need to make sure that this is available for students. Heather may have more data. She's been with the department a lot longer on previous data that we've had on some of those reoccurring issues that we had. We also had multiple contractual agreements that we were not able to agree upon and negotiate to come under one contract. And so ultimately, that's what led us to go through the RFP process so that we could make this more sustainable, we could expand these efforts, and so we could come into one contractual agreement that everybody could agree on.
And was it clear in the RFP process that we would be putting $11 million in M&O funding towards that? Because it seems like a lot of the challenges with VITA around have resulted from a push-pull of not being enough funding to sustain some of their model. And so was that something that was clear in the RFP process?
The RFP process was clear that this would be a fee-for-service model, meaning that the program is made sustainable by the third-party billing as well as the district picking up the uninsured. The issue with the ecological piece and the grant, it was currently using 98% of the services being billed to the grant were ecological services and not direct clinical services to our students. And so we hired Wirtz and Rowan. I'm not sure if you remember that, Trustee Wagner, back. I think that was presented when Integral Care and Vito was awarded those 16 campuses that had been serviced through Integral Care. Though those at that time, that is when the whole fee-for-service sustainability consultant came in and basically said that the best way for the district to maintain sustainability was through the implementation of a fee-for-service model. So in June of 2019 is when we, within Health Services, presented that to the board sometime prior to June of 2019 as an initiative from a sustainability standpoint, because at that point in time, the VOCA funding, was never a given. That was scheduled to end September 30th, 2020. And so we felt as a department to continue to sustain and maintain our mental health initiative for our student body that we really needed to focus on a new plan of how would we maintain this within our campuses for our students. Currently, prior to the pandemic, we would have approximately just a little over 4,800 encounters on 44 campuses, encounters being clients. It may be multiple times in a month that a client is seen, but it was 4,800. During the pandemic with the teletherapy, that is decreased to 2,700. The thing that was disappointing is that we had the availability for expansion, but the inability to get to an agreement made it very difficult for us to expand. And so even with the 2.2, I'm rounding up, $2.2 million per year, I believe with this a solid fee-for-service model will allow us to actually serve more campuses and more students with less money, because we will be paying for direct clinical therapy versus we have worked in a child advocacy piece, because we do recognize the value in having these professionals, these professional therapists present at ARDS and meeting with teachers and counselors and working in a very collaborative environment with our campus leadership. But we have heard through feedback within the district that we actually have internal teams that handle tier 1 and tier 2 services within the district. And that was one of the things that was brought to our attention over the course of the year. Like TBRI, SEL, counseling teams, the types of.
And back to just, I think the qualifications piece, I just wanted to clarify one last thing, and this will be my last question. Ms. Copeland, you talked about that they do have a presence working with others, working with AISD, and that they've worked with other school districts, but can you let me know what kind of a scale they've worked with them before and how large their clientele is currently?
So most of their experience with the other school districts, some of it has been face-to-face, but a lot of it has been through teletherapy, and just kind of like Vita Clinic that has, again, like ramped up with COVID happening. And so, you know, they did put a few of those school districts in their references. And so we did make sure to call those school districts to see again what scale that they had been on. And it's across Texas. So they don't just serve Austin or Central Texas, they're in the Valley, they're in North Texas, they're here. And so they have counselors all over the state of Texas, including outside of Texas, that have really provided those services to students.
But how many? I mean, is there a kind of a ballpark number that you have? I mean, is it like they've got 30 counselors across Texas, or do they have like 500 counselors or 1,000 counselors? I mean, can you kind of give me, because if we're talking about serving, what do we say, 6,000 AISD clients? That's
A little under 5,000.
Yeah, then I just want to make sure that they, I'm glad they have the experience of working across Texas. I'm glad they've had some interactions with AISD. I just want to make sure they can handle the scale that we're going to be throwing at them. And that is going to be, I would imagine with the pandemic, is only going to grow exponentially. So that's, I think, the big question. I'm not sure if I'm getting a clear answer on.
I can expand on, we did pose a question to Gramercy in regards to their hiring plan and how that would look based on the need for those. A little over 4,800 encounters per month requires approximately 34 to 35 full-time equivalent therapists for our district. And so they felt as though they've hired 3 new therapists for their internal business during the month of August. They felt as though they would need, they would be able to have 17 new therapists by the end of December, and then the remaining 17 by the end of March. And they have a very, very rigorous recruiting process with a recruiting firm. And I could go into more, I mean, the recruiting plan is very, very, very extensive as far as they require a master's degree and at least 3 years of prior experience with students, with adolescents. Lexi, things that
I'll
come
be
to
honest
mind?
too, like one of the challenges right now is that the substantiation that we received in our board materials doesn't list it doesn't show the RFP. It doesn't list key qualifications for the vendor. It doesn't show how the scoring was tabulated by the scoring committee. So I kind of feel like we're sort of flying blind, and that's why I'm asking as many questions as I'm asking. And that's why I'm looking for more specificity. With the kind of specificity I think I'm hearing at this point and the lack of supporting materials, it's really hard for me to want to move forward with committing $11 million over 4 years to the vendor. Where I would be comfortable tonight is talking about an initial approval of the contract or tabling it until next month, knowing that we have an existing vendor through December. And that actually would be my preference at this point, is to delay by a month so that we could have a little bit more insight into the RFP process and the qualifications of this vendor before we lock in for this many years and for this much cost for something that is such a critical service. So, and with that, I'll rest.
Thank you, Trustee Wagner. Trustee Cindy Anderson, and then Trustee Letitia.
I just wanted to clarify, I thought I heard you say that the current contract extends only through September 30th. Is that correct, or did I hear that wrong?
No, so the service agreement that we have goes through the end of December.
Okay, so, and I think Trustee Wagner just mentioned a couple of different options. I just want to be clear that if one of the options that had trustee support was to move this agenda item to next month, what would be the consequence of doing so?
So
Because I would wager, typically when we negotiate contracts, the terms are based on a multi-year agreement. So I don't know that we would have the option of changing the number of years tonight, because that's not something that's been approved by the vendor. So if the only other option then available, perhaps to Trustee Wagner, was to move this conversation to next month, I just want to be clear on what some of the other consequences may be.
So the biggest one is it would just delay the transition of services. So bringing on a new mental health provider, especially at the capacity that we need one at, takes months. And that's kind of how it looked like when it was Vita Clinic taking over some of when Integral Care was our provider, taking on some of their campuses. And so it would delay just the transitioning period.
Okay, so another question I have is, you mentioned that they've identified a need to hire 34 additional therapists, that they believe they can have 17 by December and 17 by March. Is that correct? So what are the consequences in terms of being able to meet the needs of our school community, especially in a situation like we're in with a pandemic, which a great deal more than even we anticipate may be seeking services. So it does make me a little nervous that based on their current estimation of need, there's still a delay in bringing on the second set of 17 until March. That's halfway through the semester and 3 months after the transition. And so I guess I would ask, why is the expectation that they not have all of those onboarded in December when the transition occurs?
So there's a couple of different factors that we're looking at. So right now, Vita Clinic has a service agreement until December, but they are only offering teletherapy. They are not offering face-to-face. And so when we're bringing on this new vendor, there's the expectation that we will have teletherapy as well as face-to-face delivery of services. We have the service agreement, again, that goes with Vita until December. Vita is willing to extend that service agreement if needed to make sure that there are no lapse in services. Again, when we did the transition between Integral Care and Vita, it takes a few months, right? Because we don't want to bring on just any therapists to come. So with Gramercy, again, Heather had mentioned that they have a very rigorous hiring process where they look at different aspects of the school as far as the demographics, the socioeconomic status, and all of those different things to make sure that their therapists fit within that school environment. So by December, they would be up and running with teletherapy 100%, just like Vita is right now. But again, the face-to-face aspect of it also depends on what stage we're on, what stage we're in the city, and COVID and all of that too. So teletherapy will be up and running as it is right now. There won't be a change in that. But again, the expectation is for teletherapy and face-to-face.
Okay, but so between September and December, there's no expectation of face-to-face, regardless of what stage we're in. Is that what I'm hearing you say?
As of right now, no. The current service agreement that we have in place is just for teletherapy. So we would have to go and amend the current service agreement that we have with Vita Clinic to implement face-to-face.
So can I ask, when did we amend that to telehealth option only as opposed to the expectation of face-to-face?
So
I don't recall seeing that.
So the funding had already been approved for it. So the previous contract that they were under didn't include teletherapy. It only included face-to-face. So again,
Right. No, I'm sorry. I'm asking when the expectation with Vita changed that we would drop the face-to-face expectation, obviously within safety and health protocol parameters, but I don't remember having that conversation that it was okay not to offer any face-to-face for the remainder of the contract term. Because seemingly to me then, I would hope that the amount of the contract was adjusted substantially if they weren't providing what was formerly a core service.
Yeah, absolutely. So originally, the service agreement that we originally had was just supposed to go till September 30th. That was the original end date of it. And then we extended it within the last month and a half to go until the end of December. So we can amend the service agreement to do face-to-face, but right now, when we were doing the service agreement, because we're in the midst of COVID, the agreement was that we would just be delivering teletherapy right now.
Okay, so I think that's part of where my confusion lies is, unless I completely missed it, I don't see that that agreement came through the board and that we agreed not to offer any face-to-face option in that amended contract. When was that before the board?
Heather and Felix, they're over the contracts.
Felix? My understanding is that it didn't need to go before the board because nothing changed with the finances of it. But Felix, you.
The terms, I think, substantially changed in terms of the expectations, at least in my opinion. I mean, I can't speak for my colleagues, but that's never been the model that we've approved as what we feel like is what our students and our community needs.
Board of Trustees and Dr. Lizalde, for the record, my name is Felix Alvarez. I'm the Executive Director of Contract Procurement Services. So in speaking, I just want to first go back to a question that was posed earlier. This is, while it seems it's a 5-year contract for almost $11 million, the base term is only for 2 years. So that's the almost absolute. I also want to reiterate that we also have a term for convenience in all our contracts that allows us to terminate for convenience at any time. As far as the question posed to my colleagues, as why the scope changed, how I can't really provide an answer to that. I have to get back to the board on that, and why it didn't come back to the board in discussing. I'm sure we discussed this with legal because the scope was for health services. I can't imagine. I got to go back to legal and speak to why it didn't come back to the board. For if there was no dollar amount changed, it was just kind of in the original spirit and intent of the original board approval.
Okay, so I guess that would be my other issue is you're saying that the amount didn't change, but the scope of services changed, in my opinion, dramatically. And so I find that problematic. But I also want to mention, while you say that the contract term is for 2 years with 3 additional potential extensions, the approval being asked for by the board tonight is for all 5 of those years up front. So that does not require the superintendent to come back in year 3, 4, or 5 and have this discussion again in front of the board. So we are in effect approving 5 years up front as it's written tonight. And so that's where I think you hear some of the concern coming from. But I think for me, the bigger issue right now is knowing that we are in a very traumatic pandemic for our staff and our students to have a major change in the delivery model of services that we are apparently paying the same amount for. And that's the expectation between now and December. I'm honestly more concerned about that right now than I am about what the transition looks like, because that has not been my understanding at all. So I don't know, I guess I'm very confused right now as to what the next steps really ought to be. So I'll let some of my other colleagues comment.
So given all the questions, Dr. Lizalde, maybe we can pull the item out and have a discussion with our board council about whether or not that should go to the board or not, the term changes and whatever other questions there might be, considering the fact that the vendor is still with us until December, the current one.
So given the information, both from the previous vendors changes, along with some of the questions that we need to provide responses to, I certainly feel the need to pull the item, but I want to make sure that I'm also not putting our students at risk. So I'd like to ask the team one more time, if you will allow me to make sure that if this is delayed until October, that if we were able to get this approved, that we would be able to still get services from this provider if what we're saying is this would continue as is. That's my first question. What happened to Alexandra? I had something.
While they go back on to trustee Anderson, did you have a?
Well, I guess I just wanted to add, Dr. Elizalde, as you're sort of determining, options and feasibility, if you could also take a look at, again, we're October 5th, bringing back 25%. By November 3rd, 100% of who wants to come back, I would think if there's any way to provide, again, within health and safety protocols, any sort of face-to-face option, I think that's what our kids are primarily used to. And it seems a bit odd to have kids physically back on campus and have to use a teletherapy model. And so I guess I would like to see if we can explore some sort of even hybrid type delivery model between now and December, because that seems like it's going to create some challenges for our students.
I wanted to ask as well, because I appreciate the questions that Trustee Anderson is asking. And I think the last piece for me is, if we're approving this now or even in October, what would be the speed by which a new vendor could even engage parents, make them aware of their new services, move them to a new model, transition students and family members to new therapists? I mean, it's a pretty jarring change right in the middle of the school year, when we're already in the middle of a lot of change and flux as it is, at a time of very high need for families. And so I just have to question the operational methodology of it as well, because of where it's falling within the school year and the challenges that we're already experiencing. So, so just one more consideration I'd like to throw in the mix as you work through that with your team.
Sure. Ms. Copeland, what would be the effects of delaying this, pulling this item from the agenda and allowing us to provide some additional information and possibly have it in an ideal world, if we were able to meet all of the expectations, if we were putting this back on for October, what would be the ramifications of that delay?
So it would just delay the transitioning from one vendor to the other, essentially. So right now we have a timeline from Gramercy on being able to have half ramped up, be able to do teletherapy 100% by December, and then have the other half of therapists on board by March. Again, that's their deadline. It could be sooner. And so delaying by a month would just kind of delay the process by a month.
And so we could then discuss if we even found the need. You indicated that VDOT could go a little longer as well beyond December 2020. So when we get together, then maybe we can just have a conversation about the entire process. So President Rodriguez, I'd like to suggest that we pull the item by the administration.
Thank you, Dr. Elizalde. I did want to just recognize Trustee Letitia Anderson, who has a comment.
So I have a couple of comments. Since they won't be able to have all the people on staff, how many schools would that impact? And if I look correctly, I believe it's 13 mental health clinics in District 1, if this paper I was looking at is up to date. So how many will be impacted? And out of this organization that will possibly be providing the services, you know, when they bring those individuals, you know, on the campus or, you know, teletherapy, you know, Mr. and Mrs. So-and-so, how would they relate to students? How do you do that with a new person over video as opposed to physically being there. So my concerns are, I know you said that now since the model was changed, you're serving about 75% of the district. You know, in addition to students, how much of that is teachers and other staff? Because my understanding is a lot of the staff really don't have a clue about where to go when they need to talk to someone. And shout out to Sheikam Sauls, who always pushing mental health. That is my guy right there. But you know, I'm very concerned about this. We are in a crazy time, and you have people that are filled with anxiety, myself included, and to be able to talk to someone is essential for mental health. And so I would hate for us to have any type of lapse in care when it could be prevented. So I'm just looking for more information in a nutshell. Thank you.
Thank you. And Dr. Elisa, I think Trustee Anderson, during this time period that that Dr. Elisa has pulled the item, they can share more information, whatever information you need. So we're gonna officially pull, at the request of Dr. Elisa, to pull item 15.4 for a vote. So we'll, thank you very much. From a vote, yeah, from a vote. From a vote. So we're now gonna move to the items for separate vote. Secretary Ellens, do you have a motion to approve agenda items 19.1 through 19.3?
I make a motion to approve agenda items 19.1 through 19.3.
Is there a second?
Second.
Is there any discussion on these items, trustees? Hearing none and having a motion by Secretary Ellens and a second by Trustee Letitia Anderson to approve agenda items 19.1 to 19.3. All those in favor, please raise your right hand. Wait, if you keep them up for a second. 1, 2, 3, 4, 5. Yeah. 3, 4, 5. Sorry. I'm sorry. 8. There it is. I was like, are the 8? All those against? All those abstaining? The motion passes 8-4-0 against, and showing Trustee Yasmin Wagner abstaining. The last agenda item under items for separate vote is on the adoption of ordinances setting the tax rate and certain exemptions, the INS tax rate and the M&O tax rate. And tonight we'll consider both the M&O and INS, interest and sinking tax rate, and then consider additional exemptions granted, which in Austin includes a partial exemption for properties identified as historical landmarks by the city of Austin. Dr. Elizalde?
Thank you, President Rodriguez. Larry Throm will be walking us through this particular item. I know some of the verbiage is a little, could be a little confusing. So I'm going to have our Chief Business Officer walk us through that.
Thank you. Okay. Yes, we have two motions here on for the tax rate. The first is adoption of the M&O tax rate, 98.9897 cents per $100 of evaluation. And much like last year, I wasn't here last year, but I've heard about last year, that the tax rate's going down. And, but it does say that there's an increase in the tax of some 4%. We'll be collecting more money. And with collecting more money, because of increased new construction in the community. the commercial and the single family and the apartments and all of that is bringing it brought new property values back there on January 1st of 2020. And that property had never been taxed before because it wasn't on a tax roll. Now it is. So it's that property that's bringing us new dollars. And there is some loss on the previous property that was taxed because the tax rate is going down. If that property had no change in their appraisal rate, and it's still valued at the same thing, there will be a slight decrease in the amount of taxes they owe the school. Now, if that property, I'm mainly talking about homestead property, single family houses, but it applies to the commercial, the people that own apartments and people that own the commercial buildings downtown. If their values went up just because our property tax went down 2 cents, it does not guarantee them that they're going to pay less taxes. The taxes could go up because their property values went up. Overall, we're going to collect more money. There's an increase in the tax rate, tax dollars received because of the new property value out there. Now, and that same story is can be said for the second motion down there for the INS. A little simpler here because there's no decrease in the tax rate. So the INS tax rate is still going to be 11.3 cents. If your home has the same value this year that it had last year, there's going to be no increase to your taxes for the INS part. But if your value of your property went up because of reappraisal, then you're going to pay more taxes at the same rate because the value of the property has increased. So with that, I will take some attempt to answer some questions and concerns you may have.
Trustees, are there any questions or clarifications? I know I have one. I just want to, yeah, I think, so trustees, there's a couple more things to just kind of mention, and I think Larry has gone through some of these. Austin ISD is lowering its maintenance and operations tax rate by 2 cents this year. Our interest and sinking rate, which is the rate that pays for bonds, will stay the same, as Mr. Throm mentioned. Despite the 2 cent decrease in the district's overall tax rate, property owners may see their taxes go up due to increases in their property's taxable values, which are set by the Travis Central Appraisal District. According to Texas law, if there's an expected increase in overall revenue due to increased property values, the district must still call its tax rate decrease a property tax rate increase. And most importantly, trustees, over the past 7 years, Austin ISD has worked to counter the rising cost of living here in Austin by decreasing its tax rate 4 different times, now taxing 12 cents less for every $100 dollars of property valuation than it did in 2014. Trustees, any questions? Clarification, Trustee Owens.
So I do have a question. I'm the one that's making the motion. And we have to have very specific wording in the motion. And the way it is written on my piece of paper says 0.04% increase in the tax rate. And is that 0.04%? Is that supposed to be 4%? Because I heard you say, Mr. Throm, 4%.
It is my understanding that it's supposed to be 4%.
Okay, so do I read it as written or do I read it as 4%?
So Larry, if I can confirm, motion 1 talks about the overall property tax. I believe that's collection because of the new property that is now included that you mentioned that wasn't included before. So that second part says by the adoption of a tax rate of $1.1027 per $100 of assessed valuation which is effectively a 0.04% increase or a 4% increase?
I've been told that the correct number there is supposed to be 4%.
Thank you.
I thought that staff had brought that down late this afternoon. I guess it didn't get made.
Thank you.
Okay. Trustees, any other questions or clarifications? And if not, I will recognize Trustee Ellens for two separate motions to approve agenda item 19.4.
So for motion number one, I make a motion that the property tax rate be increased by the adoption of a tax rate of $1 and 0.1027 cents per $100 of assessed valuation, which is effectively a 4% increase in the tax rate. The adopted tax rate of $1.1027 cents represents a reduction of 0.02 or 2 cents from last year's tax rate, resulting in an estimated annual savings of nearly $83 for the average taxable homestead based on the 2020 tax certification data from the chief appraiser. The adopted tax rate of $1.1027 cents will fund the 2020-2021 budget and reflects a 0.9897 cent maintenance and operations tax rate and an 11.3 cents interest and sinking tax rate. The interest and sinking tax rate remains unchanged from the prior year and will be used for the purpose of providing a sinking fund to be used to pay principal and interest on bonds issued or assumed by the district.
Trustee Ellis, can I just ask you to clarify that it's 0.1130 cents interest and sinking tax rate?
Yes, which is the same thing as 11 cents versus, or 0.1130. You're right. I'm sorry, I said that bad. 0.1130 interest and sinking tax rate.
Thank you. Is there a second?
Second.
Is there any discussion on this item? Having a motion by Secretary Ellens and a second by Trustee Cindy Anderson to approve motion number 1 for agenda item 19.4. All those in favor, please raise your right hand. So the motion is passed by all those on the dais. Trustee Ellens, recognize you for the motion number 2.
This has fewer numbers. So
Oh, sorry.
So I make a motion that all properties defined by the city of Austin as historical landmark properties be granted a partial tax exemption pursuant to that certain ordinance adopted by the Austin ISD Board of Trustees on April 9th, 1979, and as amended on September 12th, 1994, August 29th, 2005, and June 18th, 2012.
Is there a second?
Second.
So is there any discussion on this item? So having a motion by Secretary Ellens and a second by Trustee Letitia Anderson to approve motion number 2 for agenda item 19.4. All those in favor, please raise your right hand. So the motion passes. I'm sorry. All those in favor, all those opposed, and all those abstaining. So the motion passes 8-4-1 against, showing Trustee Cindy Anderson voting against, and 0 abstaining. So we will now recess the open meeting at 10:29 p.m. and move to executive session pursuant to Texas Government Code sections 551.074
and 551.071. For purposes of this video meeting, the board will now leave this open meeting, which will remain live online and convene privately in a separate video meeting. When we're finished with our executive session, we will reconvene here. And again, we thank you for your patience. Now reconvene the open meeting at 11:56 p.m. Secretary Ellens, do I have a motion to adjourn the meeting?
I move that we adjourn the meeting.
Is there a second?
Second.
Having a motion by trustee Ellens and a second by trustee Ann Teich to adjourn. All those in favor, please raise your right hand. And the motion passes by all those on the dais. The meeting is adjourned at 11:56 p.m. Thank you all and good night.